Good afternoon, everyone. I'm going to call to order this regularly scheduled meeting of the Public Health, Environment, Civil Rights, and Engagement Committee for Monday, November 26, 2018. My name is Philippe Cunningham, and I am the council member of the 4th Ward and the chair of this committee. With me at the dais are council members Cano, Schrader, Gordon, Johnson, and Council Vice President Jenkins. Please let the record reflect that we have a quorum. First, I would like to make sure that folks know that we have language interpretation available. Nick, could you please raise your hand? If you need help with any language services, Nick is your guy to go to be able to get the language services that you need. And also, there is overflow seating available in room 333 next to the mayor's office. So moving into our business, as this is the last meeting of 2018, we are 319, not 333. Okay, 319, excuse me. Scratch that. All right, so since this is our last meeting of the year, it's going to be an action-packed meeting, as we can see in this room. So we have 11 items on today's agenda, including 4 public hearings and a quasi-judicial hearing. We will begin with the consent agenda items, then move to the public hearing and move to the public hearings. Colleagues, I'm going to make a motion to postpone the quasi-judicial hearing until January 7th, 2019. Do I need to get a affirmative vote for all that? Okay. All those in favor of postponing, please signify by saying aye.
Aye.
Those opposed say nay. The ayes have it, and that motion carries. As a reminder, if folks are here to speak today to one of our very important items that we are discussing, please sign in over here by the city clerk. There is a list for folks to be able to speak on particular items. Moving into our consent agenda, first we have homegrown Minneapolis food council appointments, approving the following council appointments to fill unexpired 2-year terms beginning January 1st, 2018 and ending December 31st, 2019. Andrea Egger, seat 4, Ward 3, and Teresa Ophiam, seat 7, Ward 2. Confirming the following mayoral appointments to fill unexpired 2-year terms beginning January 1st, 2018 and ending December 31st, 2019. Sege Tamene, seat 12, and Emily Minge, seat 13, Ward 9. The second consent agenda item is approving the Community Environmental Advisory Commission, CEAC appointments. The following council appointments for 2 years, beginning 2019 and ending at the end of 2020, is Michelle Shaw, seat 1, Ward 1, Aaron Neoff, seat 2, Ward 2, Brady Stegoff, seat 3, Ward 8, Forrest Thiessen, seat 4, Ward 8, David Watt, seat 5, Ward 10, Jason Alvey, seat 6, Ward 4, Molly Ellis, seat 7, Ward 6, Cody Welchin, seat 8, Ward 9, Jimmy Randolph, seat 9, Ward 11, Tim Sexton, seat 10, Ward 13, and Lisa Daniel, seat 11, Ward 7. And then confirming the following mayoral appointments: Alan Campbell, seat 12, Ward 13, Thomas Olson, seat 13, Ward 10, Anthony Variano, seat 14, Ward 5, Nicole Bachnight, seat 15, Ward 1, Mariana Hefty, seat 16, Ward 9, Katie Hill Brandt, seat 17, Ward 8, Sandy Fazeli, seat 18, Ward 11, and Nicholas Minderman, seat 19, Ward 3. Also want to make sure that we're thanking outgoing members for their dedication and service: Andrew Murray, Daryl Gerber, Ellen Kennedy, James Nash, Jenna Grove, Jennifer Cruz, John Senteth, Michelle Stockness, Mohammed Makub, Tony Hanalat, Bobby Erickson, and Ricardo McCurley. Agenda item number 8 is a site agreement with AmeriCorps to host Minnesota Opioid Response Corps members. So we're going to be amending Council Action 28A-60683 to authorize a site agreement to host for 1 year a total of 2 Minnesota Opioid Response Corps members to work on designing and framing the work of the Minneapolis Health Department in collaboration with the Mayor's Task Force on the Opioid Epidemic. We are increasing that from 1 to 2, so that's really great. Number 9 is accepting a passage of resolution, accepting a donation of travel and lodging related expenses from the National Partnership for New Americans for Michelle Rivero, Director of the Office of Immigrant and Refugee Affairs, to attend the 2018 National Immigrant Integration Conference from December 9th through 11th, 2018. Agenda item number 10 is residential energy disclosure ordinances, referring to staff the subject matter of an ordinance amending Title 13, Chapter 47 of the Minneapolis Code of Ordinances relating to air pollution and environmental protection, energy and air pollution, adding provisions related to residential energy disclosure, and then also referring to staff the subject matter of an ordinance amending Title 12, Chapter 248 of the Minneapolis Code of Ordinances relating to housing, truth and sale of housing, adding provisions related to residential energy disclosure. And our last consent agenda item for today is invasive species ordinances, first referring to staff the subject matter of an ordinance amending Title 12, Chapter 244 of the Minneapolis Code of Ordinances related to housing, maintenance code, adding and amending provisions related to the removal of trees subject to invasive species infestation, and also referring to staff the subject matter of an ordinance amending Title 15, Chapter 399 of the Minneapolis Code of Ordinances related to offenses, miscellaneous, control of invasive species, tree pest, adding and amending provisions related to the removal of trees subject to invasive species infestation. And on that, do any of my colleagues have any comments or questions? All right, seeing no questions or comments, I move approval of the consent agenda. All those in favor of the motion, please signify by saying aye. Aye. Those opposed say no. The ayes have it, and the consent agenda is approved. Now we will be moving on to our 4 public hearings. Our first public hearing is to consider appointments to the Commission on Civil Rights. Frank Reed, Director of the Civil Rights Complaint Investigation Division, will be making the staff presentation. Mr. Reed, the floor is yours.
Thank you, Mr. Chair, committee members. As was stated earlier, I'm here to put forward a slate of individuals for service on the Civil Rights Commission. There are 11 slots that will be filled, 2 of which are reappointment items. We will actually achieve a number of goals in the course of doing this. 14 of the commission members will now be women. 10 will be people of color. The ordinance prescribes that there be 21 commissioners. That will be met now with the approval of these individuals. And there will be 8 attorneys seated out of this grouping now. And that, again, is something that is contemplated by the ordinance. I would also note that this group was well vetted. We had an opportunity to sit with each one of them during a lengthy and very spirited interview process, which actually started back in January of 2018 with the application process. But moving forward, we also invited the mayor's office as well as members of this committee to comment on the individuals that we chose. Because I see that there are a lot of people here today for business, I will keep my statements brief on what we're trying to do today to that. And I'll stand for any questions.
Thank you for that presentation. Do any of my colleagues have any questions or comments on the presentation before I open the public hearing? All right, seeing none, I'll open now the public hearing. Thank you. Did anyone sign in to speak on this? All right, is there anyone who is interested in speaking to this item? Anyone? Music doesn't count. Thank you. All right, seeing no one here to speak, I will go ahead and close now the public hearing. And just check one last time, any questions or comments? Seeing none, I move approval of the appointments to the Minneapolis Civil Rights Commission. All those in favor, please signify by saying aye. 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 Those opposed say no. And the ayes have it. That item is approved. Thank you, Mr. Reed. So we're now moving on to our second public hearing for today. Our next item is a public hearing to consider an ordinance amending provisions related to staple foods. Gretchen Musicant, Health Commissioner, will make the presentation today. Commissioner Musicant, the floor is yours.
Thank you, Mr. Chair, members of the committee. As stated, I'm Gretchen Musicant, Commissioner of Health, and the purpose of the presentation today is to provide a brief recap of the proposed changes to our current staple foods ordinance prior to hearing some public comments. I'm going to be a little more detailed than perhaps all these people wish I was, but I think there's a fair amount of rationale for you to hear as we go into the changes. So the current staple food ordinance, which was adopted in 2014, has 10 different categories, including milk, cheese, eggs, fruit, and vegetables, and whole grains. The ordinance is designed to ensure that no matter where someone shops for groceries in a licensed grocery store, they can find what they need to prepare a healthy meal. And just a reminder, there are many gas stations and corner stores that are licensed as grocery stores. This is especially important in neighborhoods where residents lack easy access to full-service grocery stores. So over the past few years, since these requirements are put in place, the health department staff have conducted annual store visits to monitor compliance. And while we haven't achieved the level of compliance that we might hope for, we have seen some positive incremental progress in many areas. 93% of stores are meeting 6 or more of the 10 requirements, and that leads to the justification for some of the changes that I will tell you about in a minute. 74% were stocking the required amounts of fruits and vegetables, and 85% were stocking the required amounts of whole grains. In many instances, we noticed that stores were technically not compliant with the current requirements, even though they had healthy food items in stock. For example, many stores were not compliant with eggs and milk categories, not because they didn't have any eggs or milk in stock, but they didn't have the right size package or the right specific variety. And so those are some of the things that we will be addressing. All right. So the proposed revisions include combining similar categories, reducing the total number of categories from 10 to 6, reducing the required quantities within some of the categories, and expanding acceptable varieties and package sizes. These changes will effectively eliminate requirements that may not align with consumers' cultural dietary preferences and give store owners more flexibility to stock a wider variety of culturally appropriate foods. So we'll start with the category of dairy and dairy alternative. We propose combining milk and cheese categories into a single dairy alternative category and reducing the total quantity and number of varieties required. We're also recommending allowing stores to stock smaller containers of milk and milk alternatives and adding yogurt and kefir to the list of acceptable varieties. These changes will eliminate the requirement for stores to stock cheese, which is not commonly consumed in some cultures, and give stores the option of stocking other popular dairy or dairy alternative products. It will also make it easier for stores to stock culturally appropriate cow's milk alternatives such as camel's milk, almond milk, which often come in smaller containers than we had originally provided for. Next, we recommend combining eggs and the meat, fish, and poultry and vegetable protein categories into a single animal and vegetable protein category. If stores choose to stock eggs, we propose allowing any egg size, egg type, or container size. And this may seem like, why are we even in this quandary? But we had built this ordinance off of the WIC requirements, and so we had modified the WIC requirements, and now we're finding that even those modifications were probably a little bit too focused. We observed that in many instances where stores were technically out of compliance with the eggs category, it was not because they don't have eggs in stock, but because what they have does not meet the specific requirements outlined in the ordinance. For example, many stores have extra large eggs instead of the required large size, or they stock culturally appropriate egg varieties like quail and duck eggs. This will allow for all of that. Fruits and vegetables, we're leaving that essentially unchanged, except that we are allowing for 3 frozen varieties instead of 2. This will help with some of the concerns we've heard about perishable items and the stock not lasting. 100% juice we are leaving as is. We did have some conversations about whether or not we should require 100% juice because we are also working on sugar-sweetened beverages, and while The sugars in 100% juice are natural. It is one of the areas that we hope that people are lessening their consumption. But we also know that there are many other alternative sweet drinks available in stores, and so we wanted to make sure that there was at least some 100% juice amongst those options. Whole grains. We recommend combining whole grain cereal and the whole grain category into a single whole grain category, while maintaining the total quantity and number of varieties that we currently require. This will eliminate some of the confusion that we've seen where store owners think that they must stock boxed breakfast cereal commonly found in Western diets and not finding that that was of interest to their customers, and instead emphasize the wide variety of whole grains that are commonly consumed across many different cultures. We are also allowing any size bag, box, or package except for single serving containers in order to give stores as much flexibility as possible in choosing which items to stock. Finally, we are recommending combining the canned beans and dried beans, peas, and lentil category into a single legume category, while maintaining the total quality and number of varieties that we currently require. Currently, they must stock both canned and dried products, and we are finding that in many stores, consumers will prefer one over the other. They like convenience of a canned beans, or they like the dried beans and trust them. And so this will allow that kind of variety. We are also increasing the maximum size allowed to 32 ounces so that people can buy larger bulk items dried. In summary, the Staple Food Ordinance serves an important function in setting minimum standards for businesses that want to be designated as licensed grocery stores in Minneapolis. And while the current requirements are designed to be feasible and flexible, these proposed changes will make it easier for stores to stock a wider variety of nutritious food and better reflect our customers' cultures and food traditions. I'll stand for any questions or stand aside and let the public speak. Oh, I did want to say we have received some feedback. Overall feedback has been neutral or supportive of the changes. The Minnesota Grocers Association has no concerns. In a conversation they had with one of our staff members, we have letters of support received from the Lake Street Council, Public Health Advisory Committee, Homegrown Minneapolis, High Rise Representative Council, and residents in North Minneapolis.
Great, thank you so much for that information and that presentation. And on that, I will check to see if my colleagues have any comments or questions for Commissioner Musicant. All right, seeing none, thank you so much for that presentation. And from there, I will open the public hearing. We currently have 6 speakers signed up to speak. If you have not signed up yet, it's not too late. You can still come on over here to the clerk where you can sign in there as well. And also just want to remind folks that there are language services available if people are just now coming in. So moving into the public hearing, first up we have David Thorlason. I apologize if I said your name wrong. And then up behind that person is KJ Starr. So first up we have David. If you could say your name and the address for the record, that'd be greatly appreciated.
Thank you, Mr. Chair and members of the committee. I'm David Thorlason. I'm a 43-year resident of Minneapolis. I've lived in the 2nd Ward, the 9th Ward, and for a long, long time in the 12th Ward. So I voted for some of you or your predecessors over the years. And on the whole, I appreciate a lot of the public policy goals of this and previous city councils. I don't appreciate, however, the seemingly endless appetite, the seemingly endless thirst to help run businesses that try to do well in the city. I've been paying closer attention for about the last 10 years since Councilmember Colvin Roy appointed me as a representative on the Public Health Advisory Committee, where a lot of these ideas do seem to incubate. In those years, the council has attempted at least these interventions: a trans fat ban in city restaurants, a happy hour ban. You want to tell them how to price, prescription of what benefits a business must support, prescription of what a business must pay their workers, and now this long list of items that stores must carry on their shelves. All in all, you've set out to tell businesses what they should sell, what their customers should pay, what businesses should pay for labor, pretty much the entire business proposition. You have left out one little detail. You've not joined businesses in sharing risk. If they make money, good. If they don't make money, that help from the city seems to go away. Now, I thought that a city council this aggressive in its efforts to help business must know a lot about business. Well, looking at the biographical notes on each of you on the city's website, it looks to me like 0 of 13 council members have owned or operated business enterprises of consequence, and it looks like 2 of 13 have business degrees. That's a pretty thin basis for concluding that you know more about how to run businesses than business people know how to run their businesses. So folks, instead of amending this ordinance, why don't you scrap it? Why don't you begin today to usher in a new era? Why don't you make a grand bargain with the businesses in this city that they won't do law enforcement, they won't put out fires, they won't install storm sewers, they won't run elections, they won't sweep the streets, and in return, you won't help them operate their businesses. Our city will be a lot better if we begin setting policy in this direction starting today. Thank you very much.
All right, thank you. And I apologize, I forgot to mention this. We actually have a timer for 2 minutes, and that was my apology for not stating that earlier. Thank you very much. Next up, we have KJ Starr, followed by Emily Minge.
Hello, my name is KJ Starr. I'm the Ward 2 appointee to the Public Health Advisory Committee. I've come to express PHAC's support for the amendments to the Staple Food Ordinance, as well as PHAC's request that the city require further program evaluation of the ordinance to assure it achieves its intended effect of increasing the healthfulness of consumer food purchases. You'll find the approved letter of support from PHAC in your emails. PHAC is a community of residents with public health expertise who serve to advise the City Council in matters of public health. Our committee is deeply concerned about health disparities in the city of Minneapolis. We supported the original Staple Foods Ordinance as a tool to address disparities in access to healthy foods. These disparities in turn may lead to disparities in obesity and health outcomes related to obesity, such as diabetes and heart disease, which disproportionately affect people of color. We support the amendments to this ordinance, which take into account business owners' feedback on consumer demand regarding the types and sizes of healthy foods which meet ordinance requirements. Personally, as a Minneapolis business technical assistance provider through the West Bank Business Association, I work with many small grocery stores. Camel milk is a popular milk in the West Bank, and the business owner who sells it to me tells me it has amazing health properties. One thing the amendment does is allow the sale of cow's milk alternatives like camel's milk to meet the ordinance milk requirements. As a business and consultant who works closely with the city, I appreciate this wonderful example of how city policy is made better when made in consultation with small business. PHAC and I as an individual applaud the city's partnership with small business in making these amendments, which allow stores to meet the ordinance with culturally appropriate and healthful options. PHAC also consists of many public health professionals who realize the importance of making policy decisions informed by research. For example, I came to PHAC after 8 years working as the program evaluator for the Office of the Legislative Auditor. PHAC applauds the council for being first in the nation to establish a staple food ordinance of this kind. Being at the forefront of public health policy on food comes with an obligation to assure the law works. Do you mind if I have 2 more sentences? Unfortunately, the 3-year study conducted on this law so far has not shown a change in the healthfulness of consumer purchases. PHAC requests that the ordinance continue to be studied to assure that purchasers are actually buying more of the healthy foods that are now available to them. We should not be complacent regarding health disparities in consuming healthy foods just because we pass this ordinance. We need to assure the laws we pass actually work and continue, as you're doing here, to amend them if they don't.
Great.
Thank you.
Thank you very much. We have up next Emily Minge, followed by Mary McGovern.
Hi, I'm Emily Minge. I'm a current community member of the Minneapolis Homegrown Food Policy Council and soon to be official member, and a member of the council's Healthy and Inclusive Food Access Working Group. First, I would like to read you the council's letter of support for the changes to the current ordinance. Dear City Council members and Mayor Fry, the Minneapolis Homegrown Food Council strongly supports the proposed amendments to the Minneapolis Staple Foods Ordinance. Many residents across Minneapolis, especially those in low-income neighborhoods, lack easy access to a full-service grocery store and instead rely on fast food restaurants, convenience stores, and other non-traditional outlets to meet their food needs. Limited access to nutritious foods creates a significant barrier for individuals and families trying to achieve overall good health and prevent chronic disease. The Staple Foods Ordinance is an innovative strategy to improve healthy food availability across the city. By requiring licensed stores to stock a minimum amount of staple items, we are creating food environments that promote healthier purchases and eating behaviors. The proposed amendments to the ordinance would eliminate current requirements that may not align with customers' cultural dietary preferences, such as requiring stores to stock cheese. They also combine similar requirements, such as combining the canned beans and dried bean categories, and they expand the types of acceptable products, such as smaller containers of non-dairy milk alternatives. We believe that these changes will provide stores with more flexibility to meet minimum stocking standards in culturally appropriate ways and will help improve healthy food availability and consumption in our most at-risk communities. Amending the Staple Foods Ordinance is one step towards supporting healthy eating patterns and curbing the impact of nutrition-related chronic diseases in our community. The amended ordinance also seeks to lessen the barriers store owners face when trying to adhere to the regulations while catering to specific cultural dietary needs. We strongly support the proposed policy revisions and hope that the City Council will adopt these changes. Respectfully, the Minneapolis Homegrown Food Policy Council. Additionally, never mind. Thank you.
Thank you, Ms. McGee. Sorry, I've been saying your name incorrectly all this time. All right, next up we have Mary McGovern, followed by Eric Fung.
Good afternoon. My name is Mary McGovern. I'm the president of the Minneapolis High-Rise Representative Council, the citywide public housing high-rise tenant organization representing over 5,000 Minneapolis citizens living in 42 high-rises managed by the MPHA. The MHRC strongly supports the proposed amendments to the Minneapolis Staple Foods Ordinance. Many residents across Minneapolis, especially those in low-income neighborhoods, lack easy access to a full-service grocery store and instead rely on fast food restaurants, convenience stores, and other non-traditional outlets to meet their food needs. Limited access to the nutritious food creates a significant barrier for individuals and families trying to achieve overall good health and prevent chronic disease. The Staple Food Ordinance is an innovative strategy to improve healthy food availability across the city. By requiring licensed stores to stock a minimum amount of staple items, we are creating food environments that promote healthier purchases and eating behaviors. The MHRC has been working for several years with partners to implement a variety of initiatives to improve resident health and well-being and appreciates efforts to ensure the availability of nutritious foods. The proposed amendments to the ordinance will eliminate current requirements that may not align with customers' culture dietary preferences. Example, requiring stores to stock cheese. Combine similar requirements. Example, combining the canned beans and dried bean categories. And expand the types of acceptable products. Example, smaller containers of non-milk alternatives. We believe these changes will provide stores with more flexibility to meet minimum stocking standards in culture-appropriate ways and will help improve healthy food availability and consumption in our most at-risk communities. Amending the Staple Food Ordinance is one step towards supporting healthy eating patterns and curbing the impact of nutrition-related chronic diseases in our community. We strongly support the proposed policy. Thank you.
Thank you so much. Next up, we have Eric Fung, followed by Osman Ahmed.
Hello, my name is Eric Fung. I am the owner of United Noodles, an Asian supermarket located in the 2nd Ward. I'd like to thank the council for addressing this issue, and particularly Mr. Gordon for taking these concerns seriously and working hard to propose an amendment to this ordinance. I am not a stakeholder insofar as I have always complied with these regulations, but somebody who is a fellow grocery store owner in Minneapolis came to me about a year ago stating that she's in fear because she did not. My big problem with the 2014 ordinance was that to me, it was affront to diversity. When I saw it as a kid growing up in Minnesota, I brought a lunch to school that was different than everyone else's, and I remember being teased. The good news is my son now brings such lunches to school, and people want to trade their fruit loaves for them. And but that said, I saw the requirements of cheese to be particularly odd, and milk, even milk alternatives. 90% or above of East Asians are lactose malabsorbent, according to the National Institute of Health 2008 study. And I wanted to make sure that the language was clear. As a recovering lawyer, I looked at different, I was reading the ordinance and using my statutory interpretation, and I couldn't really parse out what required an alternative, or what allowed an alternative and what did not. The new amendment makes it very clear, and I'm in complete support of it. So thank you very much.
Thank you, Mr. Fung. Next up, we have Osman Ahmed. Is Osman here? Yes, Osman Ahmed.
Good evening. My name is Osman Ahmed. I am working in Cedar Riverside area last 7 years, and I run health common to prevent chronic disease and teach community about eating healthy food. I come today ask the city council if they can add the requirement of the food to analyze the quality of the food they are selling, because we see some diseases getting up, like diabetic and blood pressure and obesity, and we know exactly what the community eat and how this is healthy. Therefore, it's very, very important to analyze the quality of the food they are selling. Thank you.
Thank you very much, Mohammed. That's all that I have on the sign-up sheet. Are there any others? Is there anyone else here wishing to speak to the staple food ordinance? Anyone? All right. Seeing no further folks wishing to speak, I will close the public hearing. Do committee members? Oh, I see we have a question or comment from Councilmember Gordon.
Thank you very much, Mr. Chair. I just wanted to thank everybody for coming. I particularly wanted to thank Mr. Fung, who brought some of his concerns to me earlier. I also wanted to thank Ms. Laska from the university for being here. Part of when we passed this in 2014 was to do a study, to review everything and see where we needed to make changes. And I think that we've proven that we can do that, and we can come back and make changes. Actually, most of the changes that we're making are to make it more simple to comply with the ordinance. I think it's a good ordinance, and there's at least one speaker who is going to necessarily support my view of it. But I think these improvements are important, and I think this is a tool that we can use to still improve the health of residents in Minneapolis and accessibility that they have to healthy foods. So I would like to move this forward for approval, and then I have an amendment I'd also like to move.
So, should we do the ordinance first and then the amendment, or the amendment and then the ordinance? The amendment first? All right. So, first, do you want to speak to the amendment that you have put before us?
Sure. So, there's one small change that I'd like to make to the language. This is something that came up after it was drafted originally. This just has to do with the definition of an accessory use grocery store. In the ordinance as written, it says the definition shall not include stores that accept governmental supplemental nutrition programs. It's come to my attention that there may be some stores that will be opening and are serving predominantly healthy foods and may want to get the governmental supplemental nutrition programs. And it seemed like we might want to have a mechanism so that our health commissioner could make a determination if some of these stores basically comply with the staple foods ordinance, but we could make an exception. So with the assistance of the attorney's office, I wanted to add this clause. Unless the Commissioner of Health makes a finding upon application by the store or proposed store that the store's inventory and business plan and practices will be sufficient to meet or exceed established public health goals with regard to providing meaningful and local community access to healthy food options. And we can discuss the amendment further if anyone would like.
All right, so we have a motion to approve this amendment. Do any of my colleagues have any questions? All right, seeing none, all those in favor of the amendment signify by saying aye. Aye. Those opposed say nay. The ayes have it, and that amendment is added. Moving back to the original motion, or the underlying motion, I'm going to go ahead and move approval of the ordinance amending Title 10, Chapter 203 of the Minneapolis Code of Ordinances related to the food code, grocery stores, amending provisions related to staple foods. Before we take a vote, I do also want to make sure that I say thank you also to Mr. Fung, who spoke to a concern that I really had. I think the number from my research was 95% of East Asians are lactose intolerant, and I believe it's somewhere between 65 and 75% of African Americans are lactose intolerant. So to see the cultural changes and the feedback incorporated in, I just want to say thank you so much to the city staff for their help, and as well as to the U for the research, and I hope we get to keep that partnership going in the future. So all those in favor of the motion, please signify by saying aye. 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 Those opposed say no. The ayes have it, and that item is approved. Thank you, everyone. Next up, we have our public hearing to consider an ordinance creating an Office of Violence Prevention within the Health Department. Coral Gardner, Director of Adolescent Health in the Health Department, will make... Oh, nope, we have Sasha. All right, we have Sasha Cotton, Public Health Specialist and Youth Violence Prevention Coordinator for the city, will be giving today's presentation. Ms. Cotton, the floor is yours.
Thank you, Chair, and thank you, Council, for having me. I, too, will try to keep my comments brief given the large scale of the agenda today. So this is just a brief overview of what an Office of Violence Prevention could potentially look like here in Minneapolis and some reference points of what other cities have done. So why develop an Office of Violence Prevention? Well, the city has been doing violence prevention work through a public health lens since 2008 with a focus on youth, and this would really help to expand our scope so that we could look at violence across the lifespan. It's a national best practice, so Minneapolis would be joining major metropolitan areas who have been doing this work out of a specific office for some time, and actually have to give ourselves a little bit of credit. We've been doing it longer than a lot of folks. We just haven't done it specifically through an office. And then there are departments across the enterprise who are doing really important violence prevention work, but that work isn't always coordinated in such a way that constituents can really feel its full impact. And this will give us an opportunity to really house that work in those specific departments, but have coordination across them to ensure that people are receiving the best possible services from the enterprise. So national best practices on an Office of Violence Prevention, I pulled a couple of examples, but these are some of the major cities that are doing them. There are dozens, but these are some of the ones that are doing it well. Chicago, I feel like it's always important to add a caveat. It's being done neighborhood by neighborhood. So we know that Chicago is facing a lot of public safety issues that have been in national media, but in the neighborhoods where they're working on some specific research-based pilot projects, they are seeing some impact. It's just not able to scale. Oh, going the wrong direction here. So San Francisco has developed an Office of Violence Prevention in 2012. and they're seeing some pretty significant outcomes with that. Their work focuses on 4 key pillars, which are coordination, outreach, employment, and policy, which is a lot of what we're already doing around the issue of youth violence prevention. Their outreach is both community level, but also looking at specific implementations of street outreach, like some of the work we've done with GVI that we haven't been able to scale with actual outreach initiatives. And their work is housed in their mayor's office, but partners with a variety of different agencies across their enterprise. And Milwaukee is another site that is doing some really innovative work around violence prevention. I bring up Milwaukee because we actually provided them the technical assistance on how to build their Office of Violence Prevention. So across the country, Minneapolis really is seen as a leader on best and promising practices, but we haven't always been able to bring those things to scale and demonstrate the great work that we've imagined here. And so the office is one step in the right direction in doing that. I think it's also important to mention Milwaukee because they were also a recipient of the recast funding that Minneapolis received from SAMHSA, and they really used their recast dollars to launch their Office of Violence Prevention. And so we want to include some of the work that recast is doing specifically around violence prevention within the office. We know that they've been doing some really innovative work, and so we would be looking at ways to partner across systems to make sure that that work is rooted in best practice, and we know that it is. So we're happy to look at this comprehensively across all the departments, and we feel like recast is a really important part of that. So there's work happening across the enterprise. We wanted to highlight some of the work that's happening in health. So we have our Blueprint Approved Institute cohort, which is a training and evidence-based program for programs that are small and wanting to learn how to scale the work that they're doing. So we're already doing training in TA across many parts of the city. We have our Coaching Boys into Men work with Minneapolis Public Schools, our pop-up parks, our GVI work, Next Step, Inspiring Youth, our Juvenile Supervision Center, the domestic violence work that we're doing, some work around sex trafficking, and parent support. So this is just a high-level list of the work that the health department is already doing. But when we look across the enterprise, there's a lot of work happening outside of health around violence prevention, or that has touch points with violence prevention. And so we feel like it's really important for one office to be looking across all these various departments and ensuring that those projects and programs are touching lives in the most meaningful way possible, and that requires coordination. And so we have some objectives, and they are to develop a citywide comprehensive plan. So as most people know, we have our blueprint, which is focused on youth violence prevention. So the city has done violence prevention planning before with community. This would be looking more comprehensively at what we can do across the lifespan and really revamping some of the things that we know may be out of date with our current blueprint since its last iteration came out in 2012. We would still definitely put a priority on young people since we know they are the most likely people just by their very age to be victims and perpetrators of violence, but this would allow us to look at the intersections of things like domestic violence and sex trafficking and early childhood exposure to violence, which are things that currently aren't captured in the blueprint. And then overseeing the comprehensive plan for violence reduction. We would oversee that plan and make sure that it's being implemented to fidelity. So these are things that our health department has already been doing with the blueprint, and we feel like we're well poised to continue that work on a larger scale. So objectives 3 and 4 would be related to data. So collecting data and analyzing those data sets to make sure that we're reaching the goals that we've set with the plan. That would be one, I think, major difference that we would look at with this plan is making sure that we have clear goals and measurements so that we can hold ourselves accountable to this council, to the mayor's office, but most importantly to the residents of Minneapolis. And then we would provide a biannual formal report to this council as well as to the mayor's office, and that would of course be made public so that constituents could measure our success as well. And the last set of our objectives would be to coordinate, convene citywide stakeholders through a prevention steering committee. We've already started that work by bringing people together from many of the sets of work that I demonstrated before together to start talking about what we're doing. And what we've learned very quickly is that we're not as aware of what each department is doing around violence prevention as we could be. And that is certainly not making us interact with the community in the way that we really could. That in a lot of ways, Minneapolis has made a ton of investment in public safety and violence prevention, but because it hasn't been coordinated, we haven't been able to give the community the right bang for its buck, so to speak. And we'd like to be able to do that in a more robust way by, one, aligning the things that we're currently doing in the city, and then being able to look externally and figure out how we can better partner with community-based agencies and community members to bring that work to fruition. And then we would ensure connections with regional, state, and federal agencies, which is, again, a big part of what we do in the health department. We are a member city of the National Forum on Youth Violence Prevention. We have existing partnerships with Cities United and Unity, which is a part of the Prevention Institute. And so we would just continue to grow those national relationships, ensuring that the work that we're doing here is highlighted, but that we're also learning from jurisdictions that are doing really top-notch work. And so with that, I would conclude. This is just, again, a high-level overview of what some of our thoughts are around an Office of Violence Prevention, and I would certainly take any questions that the council might have.
Great, thank you so much, Ms. Cotton. Are there any, yes, I see from Council Vice President Jenkins.
Thank you, Chair Cunningham and Ms. Cotton. Thank you for this amazing body of work and really looking across the enterprise and trying to understand all the different areas that are engaged in, engaged in trying to prevent violence in our communities and particularly with our young people. You noted that you have been talking to some of the various departments and community groups and agencies. Have these conversations been going on with RECAST? I know you mentioned RECAST was a big part of the Milwaukee Office of Violence Prevention, and how have those conversations been going if you have been sharing or having those?
Thank you, Councilmember Jenkins. We have been in conversation with RECAST as well as other parties across the enterprise in our steering committee meetings. So what we've done right now is convene stakeholders from internal departments, and we've been meeting to really sort of catalog what's happening to get a better understanding of what's happening across the enterprise that has violence prevention strategies within it. And then in year 2019, we'll really be thinking about alignment. And so they've been at the table. Joy Mar Stevens has been at a couple of meetings, and so has Desiree Cole. And so we want to be really clear that this is about alignment. It's not about trying to take anyone's work and move it around. It's really about looking at ways that we can make sure that the work is working to the best of its ability, and we think that that does require coordination, which is something that we'd like to be able to do.
Thank you, Ms. Cotton.
Thank you.
Councilmember Connell.
Thank you, Mr. Chair. I appreciate you leading on this work. I'm a big fan of this body of work, and I look forward to supporting it more. I know budget is coming up, and we should really talk about what it's going to take to get this office strongly on its feet, giving all of the reports that we get on a weekly, daily basis around shootings in our city. And I know that this work encompasses so much more than that. I'm really excited about the healing and trauma work that happens through folks who are on the ground doing outreach and engaging with folks that we want to support and be there for. And one thing that I've been noticing just over the past couple of months as we seek to support and empower the folks that have experienced those challenges and have survived those challenges that we're trying to address is really being able to support them in their development as well, and just ensuring that we are compassionate in the way that we work with them, because I think so many times we might miss that cultural component of understanding how we build community together with the folks that we say we're so pumped up on getting to be the forefront of the service delivery. And so things like how they communicate on Facebook and how they build relationships with people on the ground and how that translates into reporting and other things that I think for us as an institution, we also have some learning to do. It's not just them learning our ways, but how does the institution also respect and work with them and understand the realm that they have to navigate on a daily basis. So I'm really interested in working with you, out of this space in continuing to roll out this work. And I know that I'm hoping South Minneapolis will be a part of it too, and there's plans for that. So thank you so much for being steady and continuing to do your work and really providing us a strong foundation to build on, because I think your work is really reputable.
Well, thank you. We are definitely concerned with self-care and have been looking at ways and models to incorporate that into all the service delivery that we do. Obviously, cost is always a factor, and so that's been a balancing act for us, but we do, Stockton is currently, it's a requirement for their outreach workers to actually participate in some level of coaching or therapy just to sort of problem solve what they're seeing out in the community, and we would love to be able to add that to the portfolio of services that we can offer to the staff and folks who are working on contracts here.
Great, thank you. I just want to take a moment to say thank you for all your leadership. And also, one of the great things about violence prevention is that it takes community expertise and brings it into the city, whereas typically the city does a top-down. What our violence prevention efforts have really done have created space for folks to be able to build up what we know is working on the ground. And so we'll be able to better coordinate it. So thank you for your leadership on this. Again, it's common in other cities, and so I'm really excited to see us stepping up and saying that this is a permanent priority for the city moving on, that no matter who is elected, that the money that's invested in violence prevention will stay there, because we now have in ordinance the existence of this Office of Violence Prevention. So very grateful for your leadership, and also all the community members who work with GVI and work with Next Step. We have some really brilliant, we have Mad Dads and Mother's Love. We have a lot of folks who are doing really amazing work, and this is going to be an opportunity for the city to pull it all together and support it as a body of work rather than a bunch of one-offs across the city. And so this is a way to be able to, for the council to be able to more clearly, it's a systemic thing because we already have a lot of really good work that's already happening, but by bringing it all together, we'll be able to have it better organized, find where the gaps are, invest in be able to address the gaps. So I'm really excited and grateful for this. Thank you very much. Are there any other comments or questions from my colleagues? All right, seeing none, thank you very much, Ms. Cotton.
Thank you, Committee Chair.
And from there, I will open now the public hearing. We only have a few people signed up, so if you are interested in speaking, please don't forget to sign up. I will create room at the end too if you don't make it over there. But anyway, our first speaker for today is Al Flowers, followed by Faraji Shahir.
Good afternoon, Chairman Cunningham and council members. I'm here. I just heard what the health department, and I won't say a name. I just say they've been doing this for years. You've been saying the same thing. We're still dying. You know we're still dying. They're dying in Ward 4, Councilmember Cunningham. They're still dying. We just had two young people shot, one shot in the eye, two shot in the eye. They lost their eyesight. So while we talking about not implementing, we have to begin to implement things in the African American community. As I know these hearing today is, you got a hearing later about municipal ID. To support, long as we put some resources into our community so we can stop the violence. That's what y'all said before. So I need the council to recognize African American descendants of the slave. We're having a hard time right now. We don't need to be led by the health department. They've been leading us for the last 10 years. We need to work with the health department. The health department should be working with us, Councilmember Gordon. They should be working with our community. We have, the churches have put up resources for us to organize everything she just said. I went to Orlando, Florida with the deputy chief and chief of police of Minneapolis. And I done been assaulted, I done been beat up, but I know one thing, and I say this to this council, I know we can't afford to say we can't use the police in our community when we got gun violence all over our community. We can't, people are saying we don't need the police. Well, right now the African Americans need the police more than anything. And so don't play a game with my people and say what we don't need. What we need is y'all to let us really help in this situation that you haven't been letting us help all these years. You got people can come from anywhere and come right to Minneapolis and set up shop and tell you what to do. Well, listen to your residents. Listen to people who really want to do something. I had a daughter that got killed. I had a daughter shot in the chest one time, like over. I have a daughter that struggled, that's in Shakopee right now, that I fought for. You all know, if you've been on the city council, you know because the message passed around. So I know the battle. I know the battle, and now I'm asking you, we put together some with the procedural justice team, KP Popus in the police department, Deputy Chief Art Knight. I went to Orlando, and I met with the people in New Jersey, Oakland, Baton Rouge, Houston, Texas, every name that GBI didn't put up there. Are they working with the police? We can't have it both ways, Councilmember. We can't have it both ways. We need the police. Don't play me, a person that's been assaulted by the police, like we don't need them.
If you could please start to wrap it up, that'd be appreciated.
I beg your pardon?
If you could please wrap it up. The time's up for it to be fair to other folks. If you could wrap it up, that'd be appreciated. Oh yes, sir. I'm gonna give you that respect. I'm gonna wrap it up right now. But I know you heard me.
I know you heard me, and we can do this in our community. Don't try to create another office of what you just had. This is the same thing. Like 2012, she said this is the same thing they've been doing. Don't keep doing it. Put it back in the community. You say you want community police, give it to us. Let us handle our business in our community. That's what I would say, Council.
All right, thank you very much. Moving on now, we have Faraji Shahir, followed by Leslie Redman.
Good afternoon, City Council, Councilman Cunningham, and the rest. I don't know how to formally introduce that, but it's always good to see you guys. Pretty much I second what Sasha was just going through, kind of explaining the whole purpose of us needing the office inside of the health department. I am the director of the Next Step program at Hennepin County Medical Center, so I see these individuals who come in from violence wounds every day of the week, Monday through Sunday, any time of the day. And I actually got an opportunity to meet some of the individuals that Mr. Flowers was just talking about. My main reason for coming up here is in support of this office for violence prevention, simply because the work needs to be done at all levels. Inside the hospital, we see them on the ground, and we're working and we're doing the work that needs to be done to kind of take care of the families, but there are also systemic problems in our way, and this will be one of the ways to kind of tackle those barriers. Not only that, but it's not just gun violence that's plaguing our neighborhoods. It's a multitude of other issues that kind of result in the violence that we have been kind of enduring for the last 30 years. It is an excellent initiative. I just wanted to come up here and support it. Really don't have too many arguments, except that we see these individuals on a frontline basis, and then knowing that seeing an individual who's dealing with a gunshot wound or a violent assault, we do the services that we can provide, but then there aren't any services that are connected to the city to kind of make it more of a full wraparound, by just being, instead of it just being community-based organizations, nonprofits, and now the hospital-based violence intervention program. So that's pretty much what I wanted to say, and I support the decision, and hopefully we say yes to the office so that we can start tackling some of the problems in a more systemic manner. Thank you.
Thank you, Mr. Shahir. Moving on now, we have Leslie Redman, followed by Larry McKenzie.
Grace and peace, everyone. My name is Leslie Redman, and I have the honor and privilege of serving as the president for the Minneapolis NAACP. Before I begin today, I just want to take a moment to thank Council Members Cunningham and Council Members Jenkins for making sure that the NAACP always knows what's going on here. We can't make sure that our community is represented if we don't know what's going on. And I just wanted to extend the invitation to all of the council members to know that the Minneapolis NAACP is here and we care about the community. So feel free to always reach out. Moving forward, I totally support the Office for Violence Prevention. I think that it's absolutely necessary. Representative Cunningham made a lot of good points earlier. This is a systemic issue, and we have to systemize the way that we're going to go about and fix these issues and addressing them. And so it's vitally important. I think the community is more focused on how it's going to be implemented, not whether it should be implemented. It has to be implemented. It's so important, and it shouldn't be a political game with our lives. So definitely think that the office is important. Thinking about who's going to be the director of this office is going to be very vital. As I mentioned before, diversity is extremely important. We've already seen the impact. And so we want to make sure that this office has a diverse group of individuals that truly are going to represent our communities. In addition, making sure that the proper funding is poured into this office, right? Setting it up for success, not setting it up for failure. And then recognizing that this has to be a holistic approach. We've talked time and time again about the failed efforts. And a lot of the time it's been because of underfunding and also not a holistic approach. And as Mr. Flowers was saying earlier, not including the community and recognizing that we still need money poured into the community for us to save ourselves, because we're doing a great job at it with the lack of resources that we have, right? We have Ms. Lisa here with the Mother's Love. The NAACP does Warm Forgiveness Days. We see an increase when the community is involved. And so making sure that as we're even going through the process of selecting people and how the office is going to be, we need to make sure that community members are involved. And also when we think about, I talked about the holistic approach and making sure that we're considering all avenues, because prevention is vital. We don't want to be reactive, but we want to be proactive and think about the whole person and the individuals and the experts. Thanks so much.
Thank you, Ms. Redmond. Next up, we have Larry McKenzie, followed by Charmaine Wallstrom. Mr. McKenzie? All right, we'll come back to him. Charmaine, you want to come on up? State your name for the record. Then.
Hi, everyone. My name is Charmaine Wallstrom, and I'm from North Minneapolis on West Broadway Avenue. And I, too, support this Office for Violence Prevention. I really like the idea that we are coordinating the efforts of what's going on, especially within North Minneapolis. I think we also need to really focus on having people developing violence policy and procedures actually living in Minneapolis, and especially if they could live in the more violent neighborhoods like Jordan neighborhood where I'm at, I think that would be so helpful, because data can look any way you want the data to look. To actually live there and day to day hear the gunshots and see the impact on the children, that's the kind of influence we need. So I totally agree with the woman about the NAACP having somebody from the community, but also make sure it's somebody who actually lives in the community and knows what's going on. Also, I think it's very important that we make our people feel like they're a part of the community. I am very active in AA and NA meetings. Because I'm on West Broadway, I meet a lot of people with criminal records, a lot of people that feel very discarded, they feel hopeless. The only way they feel they can make a living is going back to crime. And I think one thing that we could do is try to make people feel like they're more a part of the community, because if they feel that they are a part of the community, they're less likely to commit crimes against those in their community. So, for example, we have block clubs. The current situation with block clubs is very ineffective. It's ran through the police. I don't know why. I think we need to have some kind of a community block club or neighborhood type thing going on so that we can build community, because, like I said, people are less likely to offend people they know, and they also will have a sense of pride of feeling they can help out and make the neighborhood better. Also, I think that once we are victimized, we need to know what happens. I have had guns pulled on me twice. I've been in the shootings. I have been burglarized multiple times. I got a collection of blue cards. Many of us have collection of blue cards. What happened? I would like to have something coming back, circling back, telling people what actually has happened as a result of them being victimized. Thank you.
Thank you so much for that. Do we have Mr. McKenzie, or did he head out? Seems he would head out. All right. Is there anyone else here to speak to this item?
Can I just ask a question? I'm not
Yeah, come up to the mic.
I just wanted to know where the budget was coming from, where the funding would be coming from.
So I'll go ahead and speak to that. It depends on what you're specifically speaking to, because there's funding sources in general for the GVI, Next Step, and other programs.
Right.
So I know that there is conversation about the money being moved up from MPD. There is nothing official by that.
That was my question.
Yeah, I know.
So that's that 5% that you were talking about cutting from the police budget. That's what you're looking at using, no CAM?
So you're
CAM
saying
is saying
you
no.
And none of us, yeah.
Okay, I'm just making sure. Getting it on the record.
Cool. Anybody else here to speak to this item today? All right, Mr. James Badu, if you could introduce yourself for the record, that'd be appreciated.
So I'm James Baduil, State Chair, Minneapolis NAACP, Prison Outreach, or I like to call it InReach. With the plan of housing, because we're talking about crime and prevention, there's a reason why a lot of people do the crimes. Like the sister just said that she was burglarized, and I'm sorry to hear that. That means that somebody was hungry. That means that somebody felt like they didn't have anything, so they needed to figure out the fastest way to get it. With the plan, in Hennepin County, African Americans are 55% of the homeless, but we are the only ones that didn't get any money going towards the homeless. We got $3.1 million for public housing and lower income housing, when we need to figure out how to be owners, not renters. And we're not looking at our own people. And this is in your ward. And it's unfortunate. But if we're talking about prevention, then we're talking about, let's start to change the plans on and bring in community members with the planning. Instead of making the plan and then telling us to come speak about it, how are we going to be a part of the planning in the first place? Because we're here too. That's all I want to say.
Thank you. God.
All right, is there anyone else here to speak to this item? All right, we have one more. If you could say your name and the address for the record, since we don't have it.
Yeah, hello. So I'm Molly Weatherall. I live at 1823 13th Avenue South in Phillips. So I just wanted to echo what was expressed by everyone previously. This programming is vital. And I also have a personal experience of having worked with Inspiring Youth, which was one of the programs that was named previously in the presentation. And I just want to restate that preventative work is essential and reactive work is often terrorizing to the community. And I also want to echo what was expressed about making sure the leadership is representative of the community. I think that's vitally important to keep in mind. Yeah, thank you.
Great, thank you. All right, we have Danielle. If you could say your name and address for the record, that'd be appreciated.
Yep. Danielle Tejan at 3506 Humboldt, and I'm here representing the Northside Neighborhood Council and neighborhood associations on the North Side who support the violence prevention program and want to make sure that we are part of that conversation. Being there on the ground level, being hyper local with the residents that are impacted, that we want to be a part of that work and that conversation. Just because we are there for the long term. So on behalf of the Northside Neighborhood Council and the Northside neighborhoods, we support the program and want to be a part of that work. Thank you.
Thank you so much. Is there anyone else to speak to this item? Anyone? Anyone? All right. Nope. Okay. Seeing no one else to speak to that, I will now see with my colleagues. Councilmember Gordon.
Well, I just wanted to speak in favor of this. In my first term in office, I considered the creation of our Youth Violence Prevention Action Plan one of the best accomplishments, and we got a little bit of staff there, and it's really exciting to see this growing now and understanding that the public health lens is going to offer us a greater pathway, I think, to make more of a difference and be more proactive about preventing crime and violence in our city. And so I really appreciate you introducing this, Chair Cunningham, and bringing this forward and seeing it grow. Also really appreciated that people came forward and spoke in favor of it in support, and not just in support, but with ideas and suggestions about how we can make sure that it works well. And I think that we need to keep engaging with the community and have partnerships throughout the city and try to make those as effective as possible in order for this new office to be successful. So I'll let you make the motion, but I'll be voting for it.
Thank you. I just want to clarify to folks, so I do hear the concerns. Right now, what this does is it puts it in creation, just in ordinance. It is not right now etched in stone. It has not been officially built yet. That is going to be a part of the comprehensive planning that's going to be happening moving forward that Ms. Cotton spoke to. So I just want to let folks know that absolutely we are 100% going to be centering community voice and community leadership, which is what we're seeing with GVI and Next Step, folks from the community being able to do work. So we want to scale what's working on the ground and be able to bring it to the city and make sure folks are getting paid well, make sure that folks are getting the training and support that they need. So, Councilmember Gordon.
Speaking of folks getting involved, I just wanted to put in a plug because right now we're actually setting up a community advisory committee that's going to help us give advice on violence prevention. I think we're calling it the Community Advisory Committee on Violence Prevention, Steering Committee, thank you. And we need volunteers to get engaged and involved in that and commit to meeting regularly, monthly basis so that we can help get the community voice at the table in developing this comprehensive violence prevention plan.
Council Vice President Jenkins.
Thank you, Chair Cunningham. I just want to, I think, echo some of the concerns and comments that Mr. Flowers express, in that as we're planning this work in this office, that we are careful not to usurp resources from one goal of the city without considering how it is going to impact other goals that we have as a city. And so I really want to honor the concerns that he brought forward and encourage us to really think about that as we move forward.
Great, thank you. Anyone else? All right, seeing no further questions or comments, thank you so much to everybody for coming and speaking today. Seeing no further, I move approval of the ordinance amending Title 11, Chapter 214 of the Minneapolis Code of Ordinances related to health and sanitation, Health Department, creating an Office of Violence Prevention within the Health Department. All those in favor of the motion, please signify by saying aye. Aye. Those opposed say no. The ayes have it, and that item is approved. Thank you very much, everyone. And our last public hearing for today is to consider an ordinance adding a new chapter to the Minneapolis Code of Ordinances entitled Municipal Identification Program. Christina Kendrick, Neighborhood and Community Relations Department, and Casey Joe Carl, Minneapolis City Clerk, will be making the presentation. Thank you. The floor is yours.
Thank you. Good afternoon, Mr. Chair, and may it please the committee. My name is Casey Carl. I have the privilege of serving as clerk of the city of Minneapolis. I'm appearing before the committee this afternoon on behalf of a multi-department team that has been working over several years to bring forward a proposal to establish a city identification program. This work began in the prior council term, and it carried over to this term. In this way, Minneapolis joins in a long list of cities and counties that have entered into this space and have either already created or are actively considering the creation of municipal identification programs. Under federal law, local jurisdictions may establish their own identification programs to serve local policy objectives. In 2007, New Haven, Connecticut issued the first municipal identification cards in this nation. In 2009, the City and County of San Francisco launched its ID card program, modeled on the New Haven program. Other cities that have established identification programs include New York, Los Angeles, Chicago, Phoenix, Philadelphia, Oakland, Richmond, Detroit, and Washington, D.C., to name just a few. On December 5th of last year, the Northfield City Council unanimously adopted an ordinance which established the first municipal identification program in Minnesota. Today, we're here to summarize the program proposed for Minneapolis as set forth in the draft ordinance before the committee, and which is the subject of today's public hearing. It's important to emphasize that the ordinance merely creates a programmatic framework within which the program will be developed over the next few years. The details of the actual operation have yet to be finalized, and as staff will present, these need to be the focus of the next steps in the process of finalizing the creation of the city's ID program. Before I continue, I wanted to point out I'm speaking a little bit slower. We do have a translator who is translating as I speak for those who need that assistance. You all know that I speak very quickly, so it's uncomfortable for me to speak so slowly, but I'll do my best. At the same time, I wanted to also indicate or inform council members that a new website for the Municipal Identification Program was just launched an hour ago. That site can be accessed from the City of Minneapolis's main site, which is www.minneapolismn.gov. It's also available from the clerk's website and from the city's main webpage. So the development of this program is a significant undertaking for the city enterprise. It has engaged several departments over many years. In addition to the offices of mayor and council, the following departments have been a part of the internal work group that is responsible for shaping the draft ordinance framing this proposed program. Neighborhood and Community Relations, which has provided project coordination, and in particular, Christina Kendrick, my colleague, who has been the point person for the past many months. The City Attorney's Office, and especially Andrea Neff, who is also the attorney to this committee. The Records and Information Management Division in the Clerk's Office, the City Coordinator's Office, Intergovernmental Relations, City Communications, Information Technology, Human Resources, Finance and Property Services, and of course the Minneapolis Police Department. Many of these departments are represented here today, which I believe also demonstrates a unified commitment across the enterprise to ensuring the success of this program. We are grateful for many community partners who have been eager to join us, saying that they want to be a part of this effort because they recognize it's important to the entire community and to all of our residents. So what is a city identification program? Typically, it is a program in which a local jurisdiction issues verified identification cards to ensure equitable access to services, programs, and benefits. ID cards typically feature the name and photo of the cardholder and may include additional personal data based on municipal regulations that create the program. In addition to verifying identity, these card programs can be loaded with additional benefits. For example, some city ID cards can be used as library cards or as mass transit cards for public transportation systems, and some can even be used either as primary or as secondary forms of identification to open checking or savings accounts with financial institutions. Some jurisdictions have even used their ID programs to offer incentives that can stimulate local spending. For example, local businesses can partner with the city to offer discounts. This multi-use characteristic of these types of ID programs can generate broad interest, which can expand economic participation and stimulate local commerce. The ability to provide proof of identity is a basic necessity that many Americans take for granted. Access to widely accepted forms of ID, such as passports, driver's licenses, and social security cards, is a privilege that attends other privileges, such as privileges of race, of class, and of citizenship. Because the city ID card would be available to all residents, it helps us to ensure equitable access for everyone. But this is particularly true for the most vulnerable members of the community who may have difficulty obtaining and retaining other forms of government-issued ID. In this way, the proposed city ID program ties directly to the overarching goal of one Minneapolis, a singular community composed of many communities. And in that way, the proposed ID program ties to civic pride and a sense of shared belonging. It's a vision that sees Minneapolis as a growing, vibrant, world-class city full of amenities and activities for all seasons of life, a city with a flourishing economy and a pristine environment, a city where all people feel safe and are safe, where people are healthy, and where there are equitable opportunities for success and happiness available to all. Most importantly, it's a city where people are connected with their community. Equally, it's having all communities connected to the city, where our diversity is celebrated and seen as one of our strengths and our most important assets. The City ID program seeks to capture and build on that distinctive sense of community pride felt in Minneapolis, providing all cardholders a concrete way of demonstrating their sense of pride, belonging, and commitment to the larger community. At the same time, all cardholders will be able to take advantage of the benefits associated with the program that will be built over time and continuously added through partnerships with other government agencies, local businesses, and others. With the City ID program, we hope to advance that vision first articulated by the late Senator Paul Wellstone, who said, "We all do better when we all do better." That's really at the heart of the expression of one Minneapolis. It recognizes we are stronger because of our differences, that our diversity is our strength, and that we rise and succeed together. In addition to building civic pride and capitalizing on a sense of shared belonging, the City ID program seeks to offer actual benefits to cardholders. As already noted, the ability to provide proof of identity is often taken for granted. Yet, the inability to provide this verification of individual identity impacts nearly every aspect of our lives, from opening a bank account to being able to borrow books from a library, from registering children for school to interacting with law enforcement agencies. Each of these situations requires the ability to verify identity or residency. These are examples of the tangible advantages that a City ID program can provide on an equal basis for all residents in Minneapolis. Ironically, the very people most in need of these basic services are very often those who have the most difficulty obtaining proof of identity. This can include, but not be limited to, highly mobile populations, youth under the age of 16, and especially younger kids who are in the foster care system, low-income residents, seniors, homeless residents, and those who are in transition or maybe living in a shelter or other temporary situation, immigrants, transgender and non-binary residents, individuals with mental illness or disability, and formerly incarcerated individuals who are seeking to re-enter society. These are just a few examples of those who would benefit from a city-issued identification card. In addition to serving very practical urgencies for these groups of people, identification cards also have a symbolic importance as a sign of membership in our community. Cities that have ID programs use them to make powerful statements of welcome and inclusion. Some of the unique attributes of the Minneapolis ID program, as it is now proposed, is that it would be available to all residents of the city aged 13 and up. The ordinance has been specifically crafted to fill a gap in verified identification for those younger than 16, thereby reaching younger residents who may benefit from having a city-issued ID. It also will allow cardholders to select a preferred name and to self-designate gender. And in keeping with the overarching goal of serving all residents, the program is designed to serve the needs of those who may be homeless or experiencing transition. While we want the city ID to be an all-inclusive, all-access form of verified ID that can also offer desirable community benefits, we recognize and appreciate that there are some limitations within the law that a city-issued ID cannot satisfy. These include the following. A city-issued ID card does not qualify as a valid form of identification for registering to vote, since it is not one of the statutorily authorized forms of identity verification recognized for that purpose. A city-issued ID card does not serve, nor does it substitute for, a valid driver's license issued by the state of Minnesota. A city-issued ID card does not satisfy the legally required forms of identity verification required to purchase or consume alcohol or tobacco products in the state of Minnesota. These situations are very unique, and they are subject to specific statutory regulations which would preclude the use of a city-issued form of identification for those very specific limited purposes. But perhaps most important to the community, we have commitments from local law enforcement agencies that the city-issued ID card will be recognized as valid forms of self-identification for interactions between individuals and law enforcement officers. Of course, this is a major accomplishment for the city, and we are especially proud to make that statement before the committee today. Of all the benefits associated with the proposed city ID program, perhaps none is as important to any resident as the ability to be safe and to feel safe, particularly when interacting with law enforcement officials and agencies. As the city continues to improve its relationships with the community and with all residents, this program offers one concrete way to help bridge some of the gaps between our law enforcement agencies and the people that they have sworn to protect. Again, I would remind the committee that the city's own police department has been an active partner in the creation of this program and has been at the table throughout the past many months of work while drafting the ordinance was being completed. The MPD has been and is committed to the success of this program. The draft ordinance before the committee essentially creates the framework, a blueprint, if you will, for the city ID program. Of critical importance, it defines the program's purpose, sets the required eligibility criteria, and outlines high-level program goals. The ordinance provides that all residents of Minneapolis aged 13 and up can qualify to be issued a city-verified identification card. In this context, a resident is defined as an individual who has been present within the city's geographic boundaries for at least 30 continuous days prior to applying for the ID card and who presents accepted proof of residency. The ordinance prohibits discrimination on the basis of race, color, creed, religion, ancestry, national origin, sex, sexual orientation, familial status, gender identity, disability, age, marital status, citizenship status, or status with regard to public assistance programs. The ordinance sets the minimum age of any qualifying resident at 13. It requires the resident to submit an application form, which must be signed under penalty of perjury to both demonstrate proof of identity and proof of residency within the city. The ordinance provides for an application fee at the discretion of the city if desired. And the ordinance goes on at greater detail about the eligible forms of identification that can be used to prove both identity and residency, which I will address in a moment. Before leaving this slide, I want to reiterate that the ordinance in its present form does not launch a program. It merely creates the policy framework for the program. To be clear, there remains much work to accomplish before the city is ready to issue its first ID card. For example, the city has not allocated a budget for this program. There are no personnel associated with it, and there are decisions to be made about what systems and technology, facilities, and other practical considerations need to be made. However, it was important for the city at this point to have demonstrable proof of its commitment to this program for the community, as well as for our efforts to secure community partners. We appreciate that it may feel a bit awkward to create a program without fully launching the program, but the conditions are ripe for the city to progress at this moment and bring the ordinance forward to enable the project team to advance to the next phase, which is more fully developing the tactical program details, which we will then bring back to the council for its approval. We do have a slide that will summarize our next steps to help us frame those issues for the committee in just a few minutes. This slide shows the various forms of identity and residency proof that can be accepted under the terms of the draft ordinance. As you can see, the eligibility requirements are quite extensive, but they do provide flexibility so that we can accommodate as many forms of identification as possible. We modeled these requirements on several existing state programs, and we expanded from there. The technology on the marketplace today can help us to verify the forms of ID that might be presented, assuming that they are included among the city's required types of ID. With that technology, staff can verify identity and residency and then issue a city ID card. Thus, as already mentioned, one of the next steps that we need to take in building the details of this program is what systems we need, and to that end, the Information Technology Department is finalizing a request for information, or an RFI, that will be released in the next few weeks. The responses to that RFI will help inform our decisions about how to procure systems that will support the program. And again, however, those decisions will need to be brought back to the council for final approval, along with a dedicated funding stream to support ongoing operations once the program is fully launched. With that, I'd like to introduce my colleague, Christina Kendrick, with the Neighborhood and Community Relations Department, who will speak to the next few slides. And again, after Ms. Kendrick she's been the project lead for the past many months, and she has been the staffer most responsible for shepherding us to this point. So we are especially grateful for her leadership, particularly as it regards the city's efforts to inform and engage community partners in joining with Minneapolis on the City ID program.
Thank you, Casey. Good afternoon, Chair Cunningham and council members. My name is Christina Kendrick, and I am the Senior Community Engagement Specialist for the Department of Neighborhood and Community Relations. I have the honor and privilege to what I consider do the fun part of the presentation, and that is to highlight and recognize all of the community partners who are here to speak during the public hearing portion, as well as show support and their commitment. And I will also be acknowledging our community partners and organizations and stakeholders who could not be here today. With that, I'd like to first acknowledge those partners who are here to show their support. We have Dave Hewitt, who is the director of the Office to End Homelessness and who provided valuable input into the ordinance language as we were developing the draft. We have several members of our Minneapolis Advisory Committee on Aging who are here. Janet Court, Jim Meyer, and I think Joanna Lees is somewhere around here too. Yep. We also have Joan Vorderbruggen, who is the Director of Public Art and Placemaking for Hennepin Theater Trust, who is also in the room. Oh, there she is. Hennepin Theater Trust, from the moment they heard about the city's intent to pursue possibly developing a municipal ID program, was so excited and just stated how aligned it was with their mission and goals to make their arts and culture community accessible to so many more people. We also have with us Deputy Chief Knight from the Minneapolis Police Department, Captain Anthony Hines from Metro Transit Police, Lieutenant Jim Nystrom from the U of M Police, and Chief Jason Ohado from our Park Police. We have been in multiple conversations with the help of Lieutenant Giovanni Veliz, who was flying in from New York. I don't see him in the room, but he has been very instrumental in helping initiate our conversations with our law enforcement partners, who will continue to be a part of the conversation, developing the program, ensuring that their confidence and support of RID is reflected in how the program is developed. I'm also really excited to share that today we have esteemed representatives present to speak to their organization's report. Before I move on, I was very happy to see that Bob Butterbrut, who's the Senior Vice President of Government Relations and Public Policy for Wells Fargo, who we've had conversations with, and they are very interested as this program is developed to see how financial institutions play a role in a municipal ID program, as well as Therese Kavas, who's the Government Relations Manager for the Minnesota Bankers Association. So I definitely wanted to acknowledge and was very happy to see them show up and express continued interest and keeping the conversation going. But with that, I'm really excited to invite Sheriff-elect Dave Hutch up to the podium to say a few words. I had the pleasure of just meeting Sheriff Hutchinson a few minutes ago, and I couldn't be more thrilled that he's here today.
Thank you. All right, Jeremy. I just want to say thank you, and this is very important to me through my campaign with immigration issues, but the city ID, the municipal ID will help the county partners in the fact that when we interact with people who can't get IDs now, we can have a good idea so that it saves us time, public safety's time, it saves their time, and a lot of times we can keep it in-house and not have it to go if they have to get arrested to get IBIS, which is get the fingerprints. We can circumvent that, saves time, save money. And he says the idea will help with, being inclusive members of society where, they're less intimidated to come talk to us if they have a good ID. And so my personal opinion as a sheriff-elect is I support the municipal IDs, and I think it would make our job as public safety officials easier, and most importantly, it would keep our friends safe. And that's the most important thing. That why I ran for office is to keep people in Hennepin County safe. So that's all I have, and thank you.
Thank you again to Sheriff Hutchinson for being willing to watch other public hearings and be here to speak to him and his office's support. At this time, I would like to invite up to the podium to say a few words. Rick Beeson, who's the Executive Vice President of Business Development and Government Relations, and Terry Banaszewski, I hope I pronounced that okay, Vice President of Sunrise Banks.
Thank you, Mr. Chair and members of the committee. It's good to be here. As Christina indicated, I am Corporate Development and Government Relations Director at Sunrise Banks. We're owned by Minneapolitan. We have 2 locations in the city of Minneapolis, and all 7 of our locations are in the urban area. And on behalf of Sunrise Banks, I'm pleased to be able to offer support for this product in concept, subject to final approval as you go through the process and through our own board of directors. This does represent another strategic step that we consider along with low-income tax credits, new markets tax credits, the 2% loan program, the NOAA housing program. We're completely aligned with the city of Minneapolis, our products and our mission and your needs. Banking services available to all individuals is of critical importance to us. Our compliance team has worked closely with your staff, and our compliance team is cutting edge. They're accustomed to working in the gray area. They're accustomed to working with new Americans on their products. We, up until the Department of Homeland Security closed down the program, we were the leader in remittance program in the city of Minneapolis and the city of St. Paul. So we'll be at the table as we work to take this from concept to detailed So thank you very much. We look forward to working with you as you go along here. Thank you.
And thank you, Sunrise Banks, for your willingness to continue to develop our relationship. I now want to introduce Joseph Green, General Counsel for TCF, who will share TCF's commitment to work with the city to develop financial services for Minneapolis municipal ID card holders. Mr. Green?
Thank you, Chair and members of the committee. It's my pleasure to be here to thank you for your efforts in promoting this municipal ID card initiative. I'm proud to be able to deliver up a letter from our Chief Executive Officer, Craig Dahl, in support of this initiative. So right up at the top of the House, we support efforts like this. This is very much like our financial education effort that has been underway since 2012. We offer free education to not just customers of TCF, but to anybody who can access our website. And then we also provide classroom instruction and education for adults as well. I don't think it's any secret to the folks in this room that access to financial products and services is a key ingredient to financial stability. And so being able to establish identification and obtain access to banking products and services is an important part of that process. And we're very happy that efforts are being made to construct a card that will be useful for identification to establish that access, in addition to the other benefits of a card like this in promoting civic pride and access to city services and promoting city services and discounts on those services and the like. So we really appreciate the efforts. This is a journey that we're on, and we're happy to be at the table and supply our own expertise and input to make sure this card is as strong and useful as possible. Thank you so much for what you're doing and for the time here today.
Thank you. Thank you, Mr. Green, and we definitely look forward to continuing our conversations with TCF. Now, I would like to ask Ryan Strack, Administrator, Board, and Government Relations for the Minneapolis Public Schools, to join us and say a few words.
Chair Cunningham, members of the committee, Ryan Strack, Minneapolis Public Schools. I can be quite brief in saying that in addition to all the benefits outlined for our students and families, MPS would also be more than willing to, whenever appropriate, accept the ID, particularly when families are picking up their students. They're asked to provide some form of identification, and we believe that municipal ID could be a really a good item for that. So thank you for the support, and we look forward to working with you as you continue discussions.
Thank you, Ryan. We're really excited to work on a partnership with the Minneapolis Public Schools. Clearly, there's probably a whole host of conversations that we'll be having where we can look at how a municipal ID program can benefit the children and their families. Now, I would like to invite Nick Ewell, who is the Senior Manager of Revenue Operations for Metro Transit, to talk about the exciting prospect of a municipal ID card being utilized as a transit card. Welcome, Nick.
Thank you. Good afternoon, Mr. Chair, council members. My name is Nick Ewell. I'm from Metro Transit, as Christina mentioned, and I specifically lead the fare payment department at Metro Transit. So if you're familiar with Metro Pass or Go-To Card, those are my areas of responsibility. And I'm happy to be here today in support of this potential partnership with the City of Minneapolis on this municipal ID project. We've been working pretty closely with the University of Minnesota over the last 2 or 3 years as they sort of reimagined or revisioned their student ID, their faculty ID, and their employees' IDs. And as part of that project, we've been able to incorporate technology into the card that allows those folks to have, in a sense, immediate access to Metro Transit. Their ID card is their go-to card. And so as I was talking to Christina earlier, I thought there could be some opportunities there as well. And so we look forward to continuing these discussions on how this project, the municipal ID, could reduce barriers to Metro Transit buses and trains for city residents. So thank you.
Thanks so much, Nick. They have so many great programs for low-income, senior, disabled residents as well that we had talked about, where the municipal ID card, as we develop the program and look at Metro Transit and combining the municipal ID card for a Go card, and how we can also maximize those products that are really beneficial to our communities who do need them. And we are going to continue on our multimodal transportation partnerships. And I'd like to invite Bill Dossett, who is the Executive Director of Nice Ride, to share Nice Ride's commitment. Is Bill still here? Oh, wonderful. Thank you.
Thank you.
Yeah, good to see you.
Hello, so I'm Bill Dossett, 4612 Aldridge Avenue South. I represent the nonprofit Nice Ride Minnesota, so I have a board of directors, and they have authorized me to say that we support this initiative and are excited to collaborate with it. And maybe I'll give you a little bit of idea of what that might look like. Nice Ride now operates through a contract with a for-profit company called Motivate. Motivate is the largest operator of bike share in North America. In New York City, they offer a discount to all holders of the municipal ID in New York City, and they do it for business reasons. It's just good business for them to do that. They've said, we want to do the same thing here. So that's certainly a level that we can collaborate at. Another level is our equity initiatives. So Motivate is under contract to offer discounts to our citizens who qualify. The hardest part about that is telling people about the opportunity for that discount. We see maybe there's some opportunities through this program to do that better. And then lastly, I wear another hat. I sit on the steering committee for the Shared Mobility Collaborative here in the Twin Cities. And we are looking at all this data integration and user interface integration. And one thing that we see is that cities have a much bigger role to play than anyone could have predicted just a few years ago. Because you own the streets, the sidewalks, the bike lanes, and you pay to keep them up. And the real-time data that's going to allow people to access those, you're going to control it. So as we look at this municipal ID program and access to bike share and other transportation, we are excited to see cities wrestling with these questions about who owns the data and how we deal with privacy. So thank you.
Thank you very much. I just want to quickly mention a few other partners and organizations who were unable to be here but have submitted their support to continue to either work on program development, talk about benefits and amenities that their organizations and agencies might offer a municipal ID card holder. As of recent, we have connected with Hennepin County's Commissioners-elect Angela Connolly and Irene Fernando, and we will be continuing those conversations to establish support within Hennepin County. They definitely send their regrets that they were not able to be here in person. Gail Dorfman, who is the Executive Director of St. Stephen's Human Services, has also participated in reviewing, giving input, and sends her support for a municipal ID program, especially the opportunities that it can afford for unstably and homeless individuals. Our Minneapolis Trans Equity Council has provided very valuable language for our ordinance. We also have several businesses, smaller businesses, the Bartman Group. You may know them from their many restaurants, such as Barbette, Tiny Diner, and Pat's Tap, just to name a few. Blue Door Restaurants, Butcher Salt Food Truck and Catering, and even Driftwood Bar, Grill, and Music Venue have all showed support and are excited to figure out what type of discounts and benefits and products they would be able to offer municipal ID card holders. And as you can see, I do want to acknowledge we have several residents and community groups who you will be hearing from when the public hearing portion of this agenda opens. I do want to thank again all of our stakeholders and community partners and the community here who have shown their support and willingness to continue to develop a robust and diverse list of amenities and benefits for municipal ID card holders. Now on to the next steps. Where do we go from here? As you heard earlier, our city team has worked hard to reach out to potential partners. and community stakeholders to ensure that an ordinance creates the most effective framework for establishing a municipal ID program. But engagement and relationship building will be an ongoing strategy, not only during the development of the program, but well beyond. And as we strive to have a program that is robust and accessible to all and emulates community pride, we see the benefits, services, and programs to really be an endless list of just really cool things. Before I move on, I also want to mention that as of today, this is a perfect example of how community partners and organizations, as they learn about our desire to look into developing a municipal ID program. I just had a former colleague reach out to me from Associated Banks, who is the Vice President of Development, who's very excited to hear that we're pursuing this and is looking to set up a meeting to further that conversation. It's a daily thing. I connect with organizations and agencies. So our milestones. I do want to take a moment to give a little bit of background and highlight some of our success points. As you heard earlier, there are a lot of city departments who have worked over this past year to develop ordinance language, to connect with community partners, to help connect with stakeholders, businesses, organizations, and agencies. However, we must acknowledge that Minneapolis communities have been working on this issue well before the first introduction of an ordinance draft in September 2017, and continue to work in partnership with the city on pursuing a municipal ID program. As I mentioned, you will hear today about that work, as well as the impact a Minneapolis municipal ID program can have for our residents and our communities. And I do want to mention my colleague Mariano Espinoza has been key in leading community engagement and recently joined by Michelle Rivero, who is our Director of Office of Immigrant and Refugee Affairs, to broaden the conversation and broaden the reach to all communities. So moving forward, much work has been done, but clearly there is more work to do. The proposed next steps are to create a scope of services for a program manager, designate the placeholder $200,000 that is currently proposed in the mayor's budget for a program manager contract. This could be an individual and or it could be an entity, an organization that does this work, or a combination of both. As mentioned, we are in the process of developing and releasing an RFI for the technology. We've had lots of conversations with the vendors out there who are doing this work throughout the nation, as well as with our IT department, who has been working very hard on ensuring that the menu of options that the technology could bring, that we have an understanding of what all of those options are. First half of 2019, of course, we'll execute the program manager contract. And then as we research and evaluate our other program models to develop our program, I really do want to mention again, with all of our partners, community and businesses, organizations, and agencies will all be a part of this program development. We can't stress enough that this municipal ID program is being developed to be an ID card for all that everybody wants and to show your Minneapolis pride. And then the second half, that's once we have our information. As Casey Carl mentioned earlier, we will be coming back to council with the information that we found, the proposal to move forward on what the program model would look like, a budget for that, et cetera. And once we are through that component, we will start moving forward with issuing our RFPs, scoping out staff positions, et cetera, for the program in its final form. I am now going to turn it back to Casey Carl to end our presentation, and I thank you so much. And once again, I want to thank our community partners, those who were willing to stick around. They were watching the other public hearings.
Mr. Chair, I know you have a long list of people who want to speak, so that completes our prepared presentation. Staff is happy to respond to any initial questions that council members might have about the draft ordinance. Otherwise, we'll be happy to sit down and let the public speak to you.
All right, thank you so much for that presentation. Are there any comments or questions currently from my colleagues? Councilmember Johnson.
Thank you, Mr. Chair. Just a comment before the public hearing. If folks see me stand up occasionally or step out of the room, I have a bad back, and so it's not that I'm impatient, I'm in pain, and I am very much eager to hear what you have to say, and just wanted to note that because it's a little awkward to like stand behind my chair and stuff while you're speaking, but we're in it together, so thanks.
Thanks for that heads up. Anybody else? All right, seeing no further comments or questions, thank you so much to the city staff and all the community partners for all the work today. Now I will open the public hearing. I currently have 10 speakers signed up. Again, if you would like to speak, please make sure that you sign in over here by the clerk, the city clerk. And first up, we have Terry Thompson, followed by Miriam Aguilar.
Chair Cunningham and council members, my name is Terry Thompson. I'm actually a member of Edina Community Lutheran Church. Full disclosure, my address is 3670 Knoll Ridge Drive in Eagan, but if you'll bear with me, this is the reason. I'm reading a letter from 39 people within our congregation who live in Minneapolis. So the letter reads, "Dear Mayor Frey and members of the City Council, we are proud residents of Minneapolis who collectively, as members of Edina Community Lutheran Church, join together to reach out to you in support of immigrants in our congregation and neighborhood. Our congregation includes 76 households of Minneapolis residents, as well as many families from surrounding cities and suburbs. We are an open, energetic, and inclusive congregation with an historical emphasis on social justice. We are writing to entreat the council to fund and implement municipal identification cards now. Every day that we do not have municipal IDs, community members are living in fear of being arrested and then deported. This is causing trauma to many, including children in our schools and beyond. As a congregation, we believe in creating a world that honors the dignity and worth of all humankind, and we believe the city of Minneapolis agrees. Funding municipal ID cards will assist people to support their families and continue to contribute to our community. As representatives of a city which puts pride in being welcoming to all, please take this step to show our immigrant neighbors that they are an important part of neighborhoods. Sincerely, and the letter is signed by 39 people who live in Minneapolis. Thank you.
All right, thank you, Mr. Thompson. Up we have Miriam Aguilar, followed by Luciano, and it just says Sen here, so I apologize if I say anybody's name wrong.
Muy buenas tardes, mi nombre es Miriam Aguilar.
Good afternoon, my name is Miriam Aguilar.
Vengo a dar mi testimonio sobre la importancia que puede tener el ID municipal.
I came here to
Soy madre de 5 hijos.
see the importance of the municipal ID.
4 hijos graduados de la universidad, ciudadanos americanos.
Four of them are graduated from the university and they are U.S. citizens.
Tengo alrededor de 40 años viviendo en este país y en este estado.
40 years living in this country and in this state.
Y en el trayecto de años atrás hemos visto el afecto que han tenido algunas personas que no tienen identificación, que mi madre y yo hemos ayudado y hemos albergado.
Many years behind, my mother and I, we are helping some people who doesn't have any identification.
Y hemos visto el sufrimiento de ellos, de no poder agarrar un trabajo, no poder rentar un apartamento.
We saw the suffering that they are having because they can get a job or they can get an apartment.
Simplemente por no tener una identificación.
Just because they don't have an identification.
Problemas con la escuela porque les piden de los niños que necesitan saber si ellos verdaderamente son sus padres.
Problems at school because they are verifying if they are the real parents of the children.
Y yo creo que en las manos de ustedes está para poder dar la oportunidad de ser identificados, todos los que los necesitamos.
And I think it's in your hands the possibility to get those identification for everybody.
Y podernos dar un poco más de oportunidad de poder comprar una casa, abrir una cuenta de banco, poder hacer algunas cosas que no las podemos hacer por falta de identificación.
And then get us a chance to get an account, a bank account, and get a house and get another opportunity to get something else to do that we cannot do it without an identification.
Yo les agradezco mucho haberme escuchado. El tiempo creo que se me está terminando. Me gustaría seguir hablando más sobre experiencia y testimonios que tengo vivido y que he ayudado a algunas personas que lo han necesitado.
I want to thank you for letting me talk today.
Gracias.
I would like to keep talking, but my time is over. So I just want to talk about more things that we were doing before to help helping people.
All right. Thank you. Next up, we have Luciano, and I have San here, and then Ariel Perez is up after that. All right. So I just got a sign, so I'm going to maybe come back to those. Next up, we have Matilde Teneseca and Rafael Vasquez.
Buenas tardes con todos, mi nombre es Matilde, tengo 4 hijos aquí, vivo 19 años ya aquí y pues...
Good afternoon, my name is Matilde, I have 4 children here, I've been living in this city for 19 years.
Y pues estoy aquí para pedir a los señores concejales pues que nos apoyen con el ID que es necesario para nosotros.
I'm here to ask you to help us to get this identification because it's very necessary for us.
Necesitamos el ID para rentar un apartamento, ir a recibir a los niños en la escuela.
We need the ID to rent an apartment, to go pick up our kids at school.
Y pues no tengo más que decir, estoy nerviosa. Ojalá nos apoyen. Muchas gracias.
I don't have anything else to say. I hope you help us or you support us. I'm very nervous. Thank you very much.
Gracias.
Thank you so much. Up next, we have Rafael Vasquez and Maria Herrera.
No. Mi nombre es Rafael Vázquez.
My name is Rafael Vasquez.
Vivo en Minneapolis.
I live in Minneapolis.
Por 18, casi 19 años.
For 18 years, almost 19.
Hay muchas historias.
There are many histories.
Tengo casi 18 o 19 años aquí en Minneapolis y...
I've been in Minneapolis for 18 or 19 years.
Y hay mucha gente sufriendo porque no tienen un ID.
There are many people suffering because they don't have an ID.
Lo siento mucho voy a decir cosas tristes.
I'm sorry, but I want to say something sad stuff.
Pero todos tienen que saber.
But everybody has to know.
Aquí hay mucha gente que están viviendo juntos.
There are too many people living together.
Miles. Porque
Thousands.
No tienen un ID para rentar un apartamento.
Because they don't have an ID to rent an apartment.
Hay muchas gentes.
There are many people
que creen que tienen dinero.
That they think that they have money.
Pero lo han perdido porque se lo han dado a otra persona a agarrar, a guardar.
But they lost the money because they give that money to somebody else to save it, to keep it.
Porque no tienen un ID para ir a un banco.
Because they don't have an ID to go to the bank.
Para abrir una cuenta.
To open a bank account.
Mucha gente han tenido 5, 10, 20, 15 años trabajando.
A lot of people have been working for 10, 15, 20 years working.
Le dan el dinero a guardar a otra persona.
They give their money to somebody else.
Cuando preguntan por mi dinero, ¿dónde está?
When they ask for the money, where's my money?
No hay dinero.
No, there is no money.
He oído cientos de historias de muchas personas.
I heard many stories of 100 people
que han perdido su dinero.
That they lost their money.
Después de trabajar mucho.
After working for a long time.
Tienen un ID.
Because they don't have an ID.
Hasta para ir al correo hay que tener 3 identificaciones.
Even to go to the postal service office, we need 3 identification.
Gracias por,
Thank you
por darme la oportunidad para hablar.
for giving me the chance to speak.
Y por favor, necesitamos el ID de Minneapolis.
Please, we need the Minneapolis ID.
Thank you. Gracias.
All right, thank you. Next up, we have Maria Herrera, followed by Jose Montilio.
Buenas tardes, mi nombre es María Herrera.
Good afternoon, my name is Maria Herrera.
Yo tengo 19 años viviendo en este estado de Minnesota.
I have 19 years living in this state of Minnesota.
Es necesario, pienso yo, tener un ID porque, como ya dijeron los compañeros, en muchos casos tenemos dificultades para tener un apartamento, cuenta de banco, infinidad de cosas.
I think it's very necessary for us to have an ID because we need it to rent an apartment, to open a bank account, many other things.
Les agradeceríamos que tomen en cuenta todo, no solamente a uno, sino a todos los hispanos, sino en muchas razas somos, no solamente los hispanos que necesitamos un ID.
I would like to ask you, we are not only the Hispanic who needs this ID, but more other ethnies or races that need that ID.
Yo tengo 3 hijos que son nacidos aquí.
I have 3 children, they were born here.
Y he pasado por muchas situaciones también parecidas a los que han dicho los compañeros.
And I went through many situations like the other person said.
Y con un ID yo creo que a muchos se nos va a hacer un poco más fácil la estadía aquí en este país, en este estado.
I think for many of us, an ID will make our life easier to stay in this state.
Y aparte nos va a beneficiar, creo que en general a todos, por lo que hemos escuchado de los autobuses, es en general a toda la gente que quiera tener una ID de municipal, va a beneficiar a todos, no nada más a una sola personas.
I think besides that, it will benefit everybody else. What I heard about the transportation, all other stuff that they were saying, I think it will be a benefit for us.
Gracias.
Thank you.
Thank you so much. I heard that Ariel Perez has come up, so if you want to go ahead and come up. Ariel? Yep, okay. And then after that, we'll have Jose.
Good afternoon, Chair, Council, and Council members. My name is Uriel Perez Espinosa. I'm Vice President with the Hotel and Restaurant Employees Union, Unite Here. We are about 5,000 members who are employed at restaurants, hotels, sports arenas, and convention centers, both Minneapolis and St. Paul. Approximately 70% of our members are minority immigrants and women, people of color, and LGBT members. Our members make the food, serve the food, clean dishes, clean hotel rooms, and serve drinks at the stadiums. Many of them are immigrants. Many of them, this is their first job in this country. And unfortunately, many don't have an ID. They do not speak or speak limited English. So that's a problem for many of them. Although they are vibrant members of the community, very productive, they pay taxes, and they live in small houses all together. But they are the ones who have made the Super Bowl succeeded in Minneapolis. They are the ones who have made Minneapolis flourish throughout the city with all those big events that we have in the cities. And we're hoping to have many more events like the NBA or NCAA and many other events. Our members are proud to have free health insurance paid by for the employer, but they cannot book an appointment with a doctor. Why? They don't have an ID. They cannot pick up their prescription, so we need an ID for these members. My time is up, but I would like to speak more about it, and I can send you something in writing why we're supporting this ID.
Yes, that would be great for you to go ahead and send that in fairness for everybody else. With the 2 minutes, that would be really great. You can submit it to the clerk, or you can send it via email. So if you want to check in with how you could submit that comment, that would be great.
Thank you, City Council Member. Thank you,
Thank you so
Chair
much.
Council Member.
Thank you, Mr. Perez. Next up, we have Jose and then Kathleen Ganley.
Buenas tardes.
Good afternoon.
Mi nombre es José Matelo.
My name is Jose Matelo.
Vivo 15 años aquí en Minneapolis.
I have lived in Minneapolis for 15 years.
Tengo 3 hijos.
I have 3 children.
Y en mi vida personal he vivido muy mal con mis hijos porque me han pedido un ID en la escuela.
My personal life, I have a very bad life with my children because they were asking me for an ID at school.
Siempre cuando voy a recoger a mi hijo o a mi hija me piden el ID.
Always when I have to pick up my daughter or my son, they ask me for an ID.
Porque yo muestro mi ID de mi país, no me aceptan. Tienes que tener un ID de aquí de Minneapolis.
I show my country ID, and they don't accept it because they say that I must have a Minneapolis ID.
Quisiera ustedes que nos ayuden con ese ID para poder tener unos buenos beneficios aquí en Minneapolis.
I would like to ask you to help us with that ID to have a very good benefits here in Minneapolis.
Para no sufrir en esa manera, les agradezco que oigan mi mensaje y gracias.
To stop suffering in that way, and I appreciate your help. Thank you.
Thank you. Next up, we have Kathleen Ganley, followed by Jessica Alvarado.
Hello, Councilmember Cunningham and other council members. My name is Kathleen Ganley. I teach at the University of Minnesota. I teach a class on Latino immigration and community engagement, and all of my students are very excited about the possibility of getting this ID. Some of them are here to speak today, and I just want to say that, this has been a long struggle. 10 years people have been struggling with this, and I have to say I'm finally hopeful that we have a city council that will actually pass this very important ID, not only for my students, for all the things that have been explained today, but also for the members of our society who are immigrants who have given so much to this society, economically, culturally, and otherwise. And how now I also hope that maybe we can make our city stronger by strengthening our separation ordinance that we have as a sanctuary city, where for years we have been deporting people because we have been sending them over to our Hennepin County sheriff. And I'm so thankful now that maybe we can stop doing this to the people who have been contributing so long to our society. So I have strong hope that you as a progressive, strong council will fully fund this municipal ID now and far into the future. And one of my students would love to speak right now.
Hi, I'm Alejandra Barnes. I am one of Kathleen. Yes, of course. Hi, I am Alejandra Barnes, and I am one of Kathleen's students at the University of Minnesota. And on top of being a university student, I have many family members that are immigrants as well. And growing up in this way, I realize how important a sense of community is, and I believe that the municipal ID is a great step towards building this community in a much stronger way. And it is essential that we can build this community in order to grow together and in order to support everyone that deserves all of the benefits from being a contributing member of society. And I believe that this is a very, very important step towards that goal. Thank you.
Thank you so much. I missed the Kathleen Ganley in class. I just saw the plus class, so thank you. All right, so next up we have Jessica Alvarado, followed by Mairead Harrison.
Hello, everybody. I don't speak English very well, but I'm gonna try. I'm living here for 11 years, and one of the things that I would like to ask you is, no, the idea only for help us is just because I'm gonna help to the Minnesotans citizens too, because if we can get that. We will have a proof that who we are. So if we rent a house or we buy a house, the neighbor, we know who we are. So if we have an accident driving, because the person I already here, the immigrants are here, some of them illegals. So I think that is one of the safe thing that.
Habla español.
Okay. Sería una de las cosas que ayudaría más a la comunidad, no solamente a los inmigrantes.
It will something that I will help to the community, not only to the immigrants.
Because, porque solamente cuando las personas tienen algún problema, a veces por no tener alguna identificación, se van y la comunidad de Minnesota necesita estar seguro.
Because when a person has a problem, they leave, and the Minnesota or Minneapolis must be safe.
Cuando tienen un accidente, necesitan estar seguros que alguien va a responder por ese accidente.
When they have an accident, they need to know somebody's going to respond for that accident.
Porque yo sé que a mucha gente le preocupa que hay inmigrantes con propósitos quizás terroristas, pero esto haría una comunidad no solamente segura para los inmigrantes que no cuentan con una documentación legal, sino sería más seguro incluso para las personas que están aquí si queremos vivir en una comunidad segura.
Someone think that immigrants are terrorists, but no, they are not. I think having this will help us be more safe in the community.
Muchas gracias. Thank you, everybody. I really appreciate your time. I know that my time is up. Thank you, and I hope this up. Thanks.
Thank you very much. Next up, we have Maraid, followed by Molly Weatherall.
Hi, good afternoon, City Council. Thanks for taking a moment to listen to me. My name is Maraid Herson. I go by May, and I'm a student of nursing at the University of Minnesota. I'm also an emergency medical technician. And I wanted you to consider the impact on health services that the municipal ID legislation will have. In some everyday ways, simple things include for people to be able to access library services and health education, facilitate picking up medications at the pharmacy, and also booking doctor's appointments. Finally, in the emergency department where I work, we sometimes have people who come in who aren't able to tell us who they are. And if they don't have a form of identification, we don't know who they are either, which means we can't find their medical history, but we also can't speak to them and call them by their name. So please consider supporting this legislation so that I can speak to my patients and know their names. And thanks again for giving me the opportunity to amplify voices in our community of our immigrant, trans, and also homeless populations.
Thank you very much. Next up, we have Molly Weatherall, followed by Al Flowers.
Hello, everyone. Hi again. So I just want to thank everyone who has already spoken. I think that a lot of really great information has been shared with the City Council. I also wanted to emphasize not only that I am in favor of the municipal ID, but also let's think about the cost of the municipal ID if we're building out and we actually end up approving it. All of the groups that were named in the presentation that could benefit from a municipal ID also experience higher rates of poverty. So accessibility is vital, and I would urge that to be a consideration of the City Council. Thank you.
Thank you so much. All right, next up we have Al Flowers, followed by Cesar Paulo. Is Mr. Flowers here? All right, so next up then we will have Cesar Paulo, followed by Malia Conley.
Gracias, señor presidente.
Thank you.
Gracias, concejales.
Thank you, Council.
Mi nombre es César Prado.
My name is Cesar Prado.
Vivo en el sur de Minneapolis.
I live in the south of Minneapolis.
Por 20 años aquí en las Twin Cities.
For 20 years in this here in the Twin Cities.
Como hemos escuchado, sabemos que
as we were heard,
en la ciudad de Minneapolis es una ciudad que todos los que venimos de otros lugares a vivir acá sabemos lo hermosa que es.
The city of Minneapolis, everybody who comes from another country, we know the beautiful that Minneapolis is.
Y queremos seguir trabajando, construyendo esta ciudad porque sentimos que es nuestra casa aquí.
And we want to keep working in this city because we feel like this is our house.
Podemos tener una muestra lo que es Lake Street, lo que era Lake Street 20 años atrás.
We have a sample like Lake Street before.
20 years ago, what Lake Street is now. Igual con Central Avenue en Northeast Minneapolis.
Same thing with Central Avenue, Northeast Minneapolis.
Y todo el trabajo que la comunidad junta ha hecho con todas las minorías, no solamente los migrantes.
And all the work that the community has been done, not only with the minorities.
Y la ciudad de Minneapolis tiene gran trabajo con el programa 4020, donde todos queremos ser parte de ello.
And the city of Minneapolis has a nice program, 4020, that everybody wants to be included.
Entonces, si somos parte de esta comunidad, para todos es importante tener una identificación, como hemos dicho antes ya, para saber quiénes somos y qué estamos haciendo.
So we want to be part of this community. We need an identification just to know who every single person is.
Thank you. Porque espero que pase este bill. Thank you, City Council.
Thank you. I hope this bill can pass.
Thank you.
Thank you so much. So I just got word Malia had to leave. Unfortunately, this has been a long day, so some folks have to go back to work. I understand and apologize. Next up, we have Bill Dossett, followed up by Mirta Guivero. No Bill? All right, moving on. How about Mirta? No? Okay. Jovita Morales?
Hello, everybody, Chair and City Council member. Thank you for accepting my story. So my name is Jovita. I've been living for 24 years in here in Minnesota, especially in Minneapolis. I do have 2 kids that they are citizens right now. My daughter is in college at MCTC, and she's a powerful woman who works in the community too. And my story personally on this 24 years that I've been living, I've been having a lot of experience, personally, stories that I have at not having an ID that is recognized by the state of Minnesota. So I've been using my passport and my matricula consular for a couple years, not alone. But I've been having experience when I came here this country, and as I mentioned, I couldn't open a bank account with an ID, and remember that we was changing our checks in the stores, and the store that is a small store like for instance Los Gallos, that charge us a little bit more in order to change your checks. Also, I've been experienced to have calling the 911. I was experienced in those years about domestic violence, and I was afraid to call the police. I couldn't call the police at that time. I never called actually on them to the police to report that issue because of I was afraid in that time. And that was my experience. And also I've been challenged to rent apartments. Every time when I wanted to rent apartment, they ask your social security number, or they ask you all the time the state ID. So not having that, I push myself to organize, and that's what I'm here, organizing and never give up. And as I mentioned, we sometimes, our community are afraid to come over here. Even one of the person who came, she was nervous because they was asking themselves to ask for ID, but it was so hard for them. And so I'm here with them, and hopefully you can support and pass the municipal ID, such as tremendous issues that we can solve together. Thank you.
All right, thank you, Ms. Morales. Next up, we have Dennis Scooge, and that's our last speaker on the list. Just as a reminder, folks can sign up if they're interested in speaking.
I appreciate your allowing me the time to speak. I was very intentional on wanting to be at the end. I think you've heard from, oh, by the way, I'm Dennis Skosted. I'm on the board and the executive committee of Redeemer Center for Life, which is an organization here in North Minneapolis that has served the community for over 20 years. I'm particularly appreciative that you've been able to hear our neighbors speak. Their voices are critically important. One of the things for Redeemer Center for Life, our mission is to act as an agent of hope and transformation to preserve a vibrant community in the Harrison neighborhood in North Minneapolis. I believe you, as city council members, have the opportunity to act as an agent of hope and transformation by passing this ordinance. I think it's critically important, and it needs to be done now. You've heard from a lot of folks all the benefits that can be done. I hope you will recognize that and not let the perfect get in the way of the good, that you'll get this ID passed quickly and that you'll get it implemented. You've heard the stories of our neighbors who need this, and we need this now. So please pass this and pass this quickly. There are lots of folks who want you to do this. Thank you.
Thank you so much. Next up, we have Julia Apoti, followed by Daniel Romero. And I apologize if I said your name.
Thank you. So my name is Julia Nakesa Opoti, and I live in Minneapolis, 21st and Pleasant in Whittier. And I'm here to talk, like everyone else before, I don't want to repeat so much of what everyone has said about the value of the ID. I think there's no question that there is a need for a municipal ID for different populations in Minneapolis. We're glad that the city is being cautious in how it presents itself. We have been very concerned about the privacy of people's identities, and so we're glad to see that this is being taken over. One of the things I wanted to highlight is I am a co-founder of the Black Immigrant Collective, which is made up of Black immigrants from Africa, the Caribbean, and Afro-Latinos. And we want to make sure that our voices are also part of this conversation because we're impacted by law enforcement in very specific ways, and the ways in which discrimination works means that oftentimes we are invisible and erased from a lot of these conversations. So many of our members are undocumented and also not seen. And then also, just to add another population that hasn't spoken today is also Asian immigrants, APIs, who are also one of the fastest growing of the undocumented population. And so both of these communities live here in Minneapolis, and that any work going forward, we look forward to contributing to that conversation. Thank you.
Thank you so much. And next, we have Daniel Romero.
Good afternoon, Council. Thank you for helping us to get to this point, this important point that we're at today. I hope it's okay with you that I left all of my extra shoes at home. That's a joke. The last time that I was here, I brought a bunch of shoes with me. There's a couple of things that I wanted to just mention to all of you. You know, clearly, one of the significant things that we've done here is we've built a broad coalition of support for the ID, and that includes communities of faith, it includes students, it includes union members, it includes students, and all of the other folks that folks in the presentation at the beginning of the program talked about. And that's the result of, as people have mentioned earlier, 10 years of organizing or more that has gone into bringing us to this important point on a policy issue that is one of the most significant policy issues that has ever come before the City Council here. There are two things that I'd like to emphasize to you. One is that as we were filing in this morning to this hearing, one of your colleagues stopped me, Councilman Fletcher, and he said to me, Daniel, it's important for us to talk about this data privacy issue. We really need to lock that down and figure out how we're going to deal with that. And one of the things that I think you have heard many times, but it's important for everyone to understand, that passing an ordinance, creating an ordinance to create municipal ID does not put anybody's individual private data at risk, because we won't enroll anyone. We won't start printing cards until we can protect people's private data. And so it's important that people understand that having an ordinance, voting to pass it, does not put any private data at risk. The second thing that I want to mention is just to reiterate what my friend Dennis just said, and that is the urgency of making this ordinance a reality. I'm at immigration court on a regular basis at Fort Snelling, and I can't tell you the number of times that I have heard immigration judges say that we would release a person, that they would release a person who were in Sherburne County, Freeborn County Jail, Carver County, Nobles County. They would release those folks if those people had IDs that they could be tracked to. And so real harm comes with every delay that there is in implementing the ordinance. And so I impress upon you how urgent this ordinance is. Councilwoman Cano, thank you.
We should start.
I think you may be the only name who hasn't been mentioned today. So appreciate it. Thanks.
Thank you so much. So I'll go ahead, that was the last speaker that we had on our list. I'll go ahead and ask if there is anyone else here to speak, and I will yield to Councilmember Cano to also ask.
El concejal quiere saber si hay más personas que quieren hablar, porque ya terminamos la lista. Así que es la última invitación, si alguien quiere hablar.
Anyone? Anyone? All right. Seeing no one else wishing to speak, I will go ahead and close the public hearing. Do the committee members have any comments or questions? I see a comment or question from Councilmember Johnson.
Thank you, Mr. Chair, and I just wanted to echo the same sentiment that our last speaker said about Councilmember Cano and just her leadership on this, with all the different moving pieces and parts with this and challenges and partners. And there's just a lot of work that went into this, and I really appreciate that, and the work of our staff as well and everybody involved with this.
Council Vice President Jenkins.
Thank you, Chair Cunningham. I would echo, this is an enormous effort that has brought together, a lot of communities, the senior community, the trans community, other immigrants from different ethnic backgrounds. I just hope that this sort of intersectional approach to organizing doesn't end with this campaign, and that these communities continue to work together around other issues of importance in our community, because all of these issues, as demonstrated on this particular issue, impact us all. And so I really encourage you guys to strengthen the relationships that have been built throughout this process and continue those relationships if we want to fight for full equity and equality in the future. Thank you.
Thank you. Councilmember Con. Oh, yes. Let's hear it after Council. All right. Next up, we have Councilmember Cano.
Muchas gracias a todos por estar aquí. Esta es su casa. So thank you so much for being here. This is your home. This is your place. Le quería dar las gracias antes que nada a las personas que nos han ayudado internamente a llevar este trabajo. So I want to thank the staff members who have kept this process going internally. Mariano Espinosa, el que está aquí, el gran visionario, la persona de nuestra comunidad que ha luchado con nosotros por muchas cosas, desde el DREAM Act hasta las licencias de manejo, ahora con el ID municipal. So Mariano Espinosa from the Neighborhood and Community Relations Department, who's one of our community leaders who's taken on the DREAM Act, driver's licenses, and now municipal ID. To the little engine that could, Christina Kendrick, who kept us on task and kept making sure that the work was moving forward every day, even when it seemed impossible. We were there every day, plugging away, and here we are now with this incredible coalition. Tina Kendrick es una persona que le puso mucha energía al proyecto y nos siguió avanzando hasta hoy. I also wanted to thank David Rubador from the Neighborhood and Community Relations Department, as well as our City Attorney's Office, and now Casey, our City Clerk, who is taking the baton and taking this program to the next level, and we're so happy for this professional and well-founded support moving on to the next phase. Hay muchas personas internamente que han apoyado este proceso, muchísimas personas del gobierno municipal. And a special thanks to Jamie Makepeace from the Mayor's Office, who's here in the room with us today, who has been a driving force of the heart and spirit of this initiative, because in a time when there's so much division, we really need something to unify us, to help us stand together, to help us stand strong, to embrace each other, and to know that we will get through the tough times. En estos momentos de tanta división, es muy importante tener algo que nos unifica y que nos hace pararnos juntos para pelear contra las cosas que nos están oprimiendo. So moving forward, I'm just really excited to continue this work. This is not, we were hoping this would be kind of like a crossing the finish line, but as we're becoming more and more aware of all the details of the program and the amazing potential and partnerships and the dynamic effort here, we know that this is just one chapter of what's going to have to continue and what will come. Everything from continuing the monthly meetings with our community. We have one of our great organizers here, Jovita Morales, who has been also providing a lot of support for this effort. And the White House, thank you, Julie, for being here and for providing support for our Latino community members to be here, and for the other members, too. As our Council Vice President mentioned, this is a very beautiful coalition. It's very diverse. It's very dynamic, as I mentioned before. It's very inspiring. And this is one of the most beautiful rooms that I've been in over the last 5 years as a City Council member. So this is a very special moment for me because I haven't seen so many people driving so much deep work together in such a long time. So thank you so much for being here, and I look forward to continuing to dig deep and make sure that this program becomes a reality with you. The first day that we're able to issue a municipal ID card, I will be there with you, with my kids, and I hope that all of our council members will be there too. So thank you to the chair of the committee for entertaining this public hearing, for letting us have this discussion. And I would be remiss if I did not acknowledge Andrea Neef, who's our city attorney that's sitting here in the dais with us, who has had multiple meetings for the last 6 to 9 months on this effort with us. So we are doing something very unique and very much needed and very much welcomed by our city. So muchas gracias a todos. Thank you all.
Thank you, Councilmember Cano. Are there any other comments or questions from my colleagues? Councilmember Gordon.
Well, I hope this passes, and I can't wait to get my city ID as soon as possible. So hurry up, team, and get all those details worked out.
All I really need is the date so I can make sure I get a haircut, so I'm ready for the picture. So, thank you so much, everyone. I want to also just echo the gratitude for the multitude of people who have been listed, who have really worked on this for quite some time. Thank you to Councilmember Cano for leading this, and it looks like she has something else to add.
I forgot something very important. I wanted to recognize the Minnesota Immigrant Rights Action Coalition, who established a coalition to launch this effort, and they're here in this room, and they've been ensuring to communicate with us and to press upon us the importance of this initiative. So together with the White House group, which is the group that Jovita is in charge of, and the one that many of the folks here are today, there's a lot of people that are behind this effort, so I'm sorry if I'm going to miss some names, but I do want to acknowledge that there's many MIRAC members here, especially Ninth Ward residents, who helped to advance this discussion and bring it to, I don't want to say fruition because we're not there yet, but closer to fruition, so thank you.
We're not quite there yet, but this is a huge step because it's saying that the city of Minneapolis, the city council, that the staff are saying, yes, that we take this seriously and we want to see this implemented in our city. So seeing no further comments or questions, I move approval of the ordinance amending Title II of the Minneapolis Code of Ordinances relating to administration, adding a new Chapter 42 entitled Municipal Identification Program. All those in favor of the motion, please signify by saying aye. Aye. Those opposed say no. The ayes have it, and that item is approved. The last, yes. Thanks for that. I'm all business. Way to go, everybody. Good work. So the last item that we had was the quasi-judicial hearing, which we pushed off, postponed to the next meeting. So I just want to say before we close out, thank you to all of the staff from the Health, Sustainability, Civil Rights, Neighborhood and Community Relations departments and the Youth Coordinating Board for making that my first year as a council member and as the chair of this committee. It's so amazing. I feel lucky every day to be able to be the chair of this committee where you can see so much amazing work happens and there's so many hardworking staff, and so I feel really grateful for this role. Also, to all of the remaining riveted viewers at home and folks here, make sure that you your voices are heard. So you can check out LIMS, LIMS.Minneapolis, MN, at Minneapolis spelled out, .gov to learn more about upcoming council actions and to make your voice heard by calling your council members. With that, seeing no further business before this committee, we are adjourned.